My name is Pia Huber. I'm the chair of the BAcC, and I would like to introduce Gil Tung. He is a Chinese medicine physician and a lecturer, and you're based in Amsterdam. And Gil will talk today about correcting the earth, Taiwan's Tung acupuncture to treat the digestive system. There will be time at the end to ask questions, and I'll hand over to Gil.
Thank you
very much.
Well, good afternoon, everyone. How are you? How was lunch? Good? Really? I'm kidding. Okay, welcome to this section. My name is Gil Tung. I will talk today about, I will try, 3 hours, it's a very limited time. I will try to do my best to inspire you. That's my main goal. We'll talk about Master Tung's acupuncture. In English, we say Tong with T, but actually in Chinese, it's Dong. And it becomes even more complicated because in Taiwan, they use a different system, not the Hanyu pinyin, this is Hanyu pinyin, this part. So I wrote down all the Chinese characters and the way you should pronounce it with the tones. For those of you who are interested in Chinese, I lived in Taiwan for 6 years. Originally, I'm coming from Israel, and I'm based in Amsterdam. So it's a bit weird in a way. But yeah, I'm Israeli, and I spent 7 years in Asia, 1 year in Beijing, and 6 years in Taiwan doing my postgraduate degrees. I'm very interested in research, but I'm a clinician. And in Taiwan as well, I had the opportunity to study with great teachers, and I will tell you briefly about my story, but we'll focus mainly on Master Tung's acupuncture. Today's lecture will focus mainly on the points that affect the earth, means the digestive system, the spleen, stomach. And I will start with my truth. I'm not a master, and I'm not how you pronounce it? Disciple. I'm not officially a disciple of the lineage. I did study with second-generation apprentices and third-generation apprentices. I'm definitely not a master. I'm just a curious individual who use Master Tung's the past 10 years. I studied it first in the West, and I think this is why I call it Taiwan Master Tung's acupuncture, because there are mainly two main approaches of the West and the East. The East represents Taiwan. Okay, so I'm very curious. I was fortunate to learn with good teachers, and my patients obviously are my best teachers, and I'm learning from them every day. As well, 6 years in Taiwan helped me a bit to learn Chinese. So I obtained knowledge from primary sources. I will talk about those sources in Taiwan. Unfortunately, those doctors, they don't speak English, but to my opinion, they are at the highest level in terms of this style of acupuncture. Outline for this presentation, first part will be theoretical part. It will be about 45 to 15 minutes. My suggestion, I won't take it personally if you leave, it's okay. But my suggestion is to stay for the 3 hours, because the second part will be the points themselves and how to use them in the clinic. Okay, so to my opinion, my personal opinion, the first part is the most important part, because if you get it in only 45 minutes, 50 minutes, let's say, it will help you further on. Now, before I start, I want to ask, also, I want to say that obviously 3 hours, it's a very limited time. Originally, when I talked with the organizer, I told them, let's do it more, 4 hours, or I want to make demonstration as well, because demonstrations are very important, especially 1-1 area, 2-2 area, the areas of the palm, which is a very important area in Master Tung's acupuncture. You need to know how to do it practically. But unfortunately, we cannot do it. All kinds of legal issues and insurance and I don't know. So I have needles here, and off the record, if it's not recording, if somebody wants to do a demo, so you can do it on me if I will pass away. So if I will, my problem. Okay, before I start, it's very important to acknowledge and because I feel very a great appreciation and gratitude to 3 people mainly. So in Chinese we say the 3 treasures, right? The San Bao. So the 3 treasures, we have like the Shen, the Qi, and the Jing. So the Shen is kind of like the spiritual one. It's the heaven. So for me, the spiritual one is Master Dong. Now, Master Dong was a real person. He died in 1975, but he was a real person. It's not like San Si Miao or Zhang Zhongjing or those doctors 2,000 years ago, 1,500 years ago. This was a real person. Lived in Taiwan, and I will talk briefly about him. So he's kind of like the spiritual one. There are many stories about him, about the way he treated patients, and so on. The Jing one, more the material, the earth, is Dr. Li Guozhen, which is still living in Taipei, in Taiwan, and I studied with him in Taiwan. And the Qi one, the energetic and more like the human, is Sean Goodman. He's my teacher from Israel, and through him I got to know Master Dong's acupuncture. And he's a great teacher. He's teaching in Israel, but also in Europe. Before I start, any of you has previous background in Master Dong's acupuncture? Raise your hand, please. Only one? Oh, wow, it will be easier. Only you? Where did you study with? Like, you study with who? By yourself? Yeah. No. Previous teachers? No. So all of you don't have any experience with Master Dong acupuncture? Okay, okay. It just jumped here. Any of you study in China or Taiwan? Okay, so usually when you study with a Chinese doctor in China or Taiwan, they tell a lot of stories. This is like part of the thing, sharing stories. So I must share one story with you to respect the tradition. So in 2015, I moved to Taiwan, and I already knew this book, Advanced Tong Style Acupuncture, written by James Meyer, American practitioner, lived in Taiwan in the 80s. And he wrote this fabulous book, but the moment you open this book, and I highly recommend you about this book, when you open the book, it's a very thick book, a lot of points. And you look at the points, and tons of indications and weird numbers, and you look at it and it's like, what's going on? What is it? It's like you feel overwhelmed. So, but it's the best book, the best clinical book, really. And I went to Taiwan in 2015. I already know about this book. I learned with it in Israel back then. But in Taiwan, I was sitting in the hospital, and then they asked me, part of my internship in the hospital, they asked me, do you want to present a case? So I'm like, yes, of course, I'll present a case. I had a nice case with enuresis, a lot of urine problems, a female patient. And after one treatment, there was a strong reaction. I used Master Dong's acupuncture, and afterwards we did a series of treatment, and she felt much better. Sorry, interstitial cystitis, yes, interstitial cystitis. And then I did this case report in Taiwan. And then the 3rd generation apprentice, she's like, she told me, hey, I have a teacher, a 2nd generation, Dr. Li. And I'm like, wow. And then I opened the book and I show her, this is the book, and it's written Dr. Li Guozhen in English. And she's like, wow, I didn't know this book exists. And through this story, I found her, and coincidence, totally coincidence. And then I found Dr. Lee, and I started to study with him in Taiwan. So that's my own story. Okay, few misconceptions about Master Dong's acupuncture. Usually in the West, it's been confused with Dr. Tan. I don't know why, maybe because of the last name, Tung, Tan. My last name is Ton. Yeah. We are not cousins. There is no connection between Tong and Tan, and definitely there is no connection to balance method. Any of you study balance method? No way. Only you? Only you in the back. No connection between balance method and Tong. Okay, Richard Tan, he passed away a few years ago, and he was a great acupuncturist. In his lectures, he always mentioned Master Dong's points. Okay, so due to that, and balance method is very, very famous for pain management, there is a misconception that Master Dong's acupuncture is mainly used for pain management. But this is also wrong. Master Dong's acupuncture, the points that we'll talk about today, are very strong. Majority of my time I just use acupuncture. I'm trying not to use herbs. I know how to use herbs, but I'm trying just to use acupuncture, and I think I get good results. My teacher gets good results. Our colleague and community in Israel and abroad, people are using this style of acupuncture, getting good results. Acupuncture can do much more than just treating pain. It's a misconception, especially with balance method and doing those treatments when you have a knee pain, you treat the elbow and so on. And due to that as well, because Richard Tan used to teach it, he used to teach his balance method approach with the 12 channels, the 12 main channels, and then he used to add Master Dong's points. So people used to call it unique extra points. It's like unique extra point. And this is what I want to teach you today. Maybe it will be more complicated than I think, because you don't have previous background, which is good. But on the other end, you don't have any background in this style of acupuncture. But it's not just points. It's not like empirical points. There is a system behind it. There is a logic behind it. And my hope for today to inspire you and to cause you to understand this system. Okay? It's not just extra points. Another common mistake is that Master Dong's acupuncture Tong system viewed through the 14 channels. Okay, so the 14 channels are the 12 main channels of the 12 organs, and Ren and Du. The rest of the channels don't have their own points. But it's wrong. There are other channels, okay? And we'll talk about them today. It's wrong from my perspective and from the perspective of the east side of the world. So this is why it's Taiwan's Dong's acupuncture. We use a minimal number of needles per treatment. So usually Yang Wei-jie in the West, he was a first generation apprentice, and he used to teach, he has a one needle technique approach. And then I went to, and I learned with him first. I learned with Yang Wei-jie and his style of thinking, and then I came to Taiwan and I saw they're using a lot of points, and it was very effective, very, very effective. So it's not about counting numbers, how many points we use. It's about getting the best results for our patient, and it's about what we are aiming to do in the treatment. We want to treat the lung, so we choose points that affect the lung. If it will be 6 or 12 or 15 or so on. There is no, as long as there is rationale in the treatment, it will work. And not more than Dao Ma set in each limb, because nobody has studied Dao Ma and nobody has previous diagnosis in previous experience in Master Dong. We'll talk about this as well. This is the reference list. I highly recommend. This is the reference list. The ones that are marked in blue are the most recommended ones. Obviously, Dr. Hu and Dr. Lee are doctors from Taiwan, and their books are in Chinese, but You can still get some information from them. Master Dong's Advanced Dong Style Acupuncture of James Meyer. Also, I really like Wang Ming Chuan's book. So these are my favorite references. Okay, so briefly about Master Dong. He was born in 1916 in China, in Pingdu County, in Shandong Province, to a middle-class acupuncture family. In 1949, he immigrated with the KMT army and other civilians from China to Taiwan. Later, he lived in Taipei. He opened his clinic, his third clinic. He had clinic before. He was a generation of acupuncturist family. Okay, so he had his father had a clinic in China, and then he opened a clinic. But then there was the war between China and Japan, and he escaped to Taiwan after the nationalists lost. The stories are telling that he had a stepson. And his stepson didn't want to learn, he didn't want to become an acupuncturist, so he didn't want the tradition to lose in the history. They lost a lot of books throughout the history with the war in Japan and China. So in 1962, he started to accept students. So these are the 73 students. So this thing you can find in his grave in Taiwan. All the 73 students are written over there, and Yang Wei Jie is one of them. He immigrates to the U.S., to Los Angeles, and he's a great scholar, a great physician, and he's responsible of the spreading out in the West of this acupuncture style. But there are less known doctors like Hu Wenzi, that he's still in Taipei. He just retired recently. Yuan Guoben, he wrote the original book, is in Taiwan. And Wang Mingchuan, he also immigrated to the US, and I mentioned his book. He has a great book, and I like his style of thinking. His style of thinking is more similar to Hu Wenzi. So in Taiwan, when I lived there, I organized workshops, 3 workshops with Dr. Li. Okay, so Dr. Li is a second generation because Dr. Li studied with Dr. Hu. So both of them represent more or less the same idea. I didn't study with Dr. Hu. I visited once in the clinic in Taipei. I think Dr. Hu is, and his books are incredible, really, really good books. So these are the photos from Taiwan. So in 1973, Dr. Yuan and Master Dong published its only textbook, and this is the original book. And in English, it calls Tung's Acupuncture and Mock Sebastian, Extraordinary Points and Straight Channels. Okay, in the book, it's written that there are about 740 points located in the body. However, in the original book, only 185 points, more or less, are inside the book. So there are a lot of points that were not included in the book. So this is a passage coming from Wang Mingchuan's book, written by Master Dong. He said, "It is very sad that the original Tong's acupuncture textbooks were destroyed during the war in my ancestor era. Fortunately, I've memorized the secret key in rhymes that were assessed down in my family by oral tradition. And after I treated 300,000 clinical cases, he treated a lot of people for free. He received a lot of honors in Taiwan because of that. And he was able effectively to confirm this theory. So although he had a very exceptional memory through memorizing the rhymes and the poems, the songs, only after he had the clinical experience he was able to build up his family system. So as I said, in 1962, he started to accept students. In that time, we need to understand something. When you look at the original book, if you look at the original book, or you look at James Meyer's book, there is a lot of Western biomedical terms. So back then in Taiwan, Western medicine became more dominant and more popular. And Master Dong was inside of this time era where Chinese medicine was started to be kind of like in the mid-70s, Chinese medicine was regulated in Taiwan. So until then, it was kind of like from father to son, and more like a folk medicine. And then it started to be regulated, and the influence of Western medicine was very dominant. So he used a lot of Western biomedical terms. So the indications are a lot of names of diseases, which you'll see soon. As well, he used the term nerve in order to describe the influence of his points on the Zhang Fu organs. So Master Dong knew exactly what he was saying, but he used biomedical terms which we'll discuss later on. So it was mainly influenced because of the time in Taiwan. In his book, he also said something very important. He said, the channel system used by my ancestor is different from the 14 channels. Whoever can read Chinese can read the original passage in his Chinese books. This translation coming from Wang Mingquan's book. He said it's different from the 14 channels. The location of Dong's points are different from the 365 points of the traditional acupuncture. This style of acupuncture focuses more on acupuncture than moxibustion. In this style of acupuncture, we barely do moxa. Only one point was indicated for moxa. We do a lot, though, bloodletting. Bloodletting is a very key aspect of this style of acupuncture. And needling, okay? A lot of difficult diseases were cured very quickly by my family's system of acupuncture, and Tong's family has its own origin and has its own tradition. But Master Dong didn't talk so much in the clinic. Students used to follow him and observe him, okay? And each one of them interpreted his own idea of what it is. So back then, you know, even now when I study in 2011 with Wang Zhui in his clinic in Beijing, you don't go often to ask questions. We as foreigners, as Westerners, we ask a lot of questions. But in China, you don't do that so much. It takes time, you know, to build up trust, and you don't ask stupid questions. So basically, they were kind of like afraid, you know, to go to the master and to ask questions. So they used to observe him, and they used to look what he was doing. So there are a lot of, for example, points are located on the lung channel. So some disciple, apprentice, thought it's on the Jue-in channel because of, you know, the angle. You look at the patient lying down, and sometimes you're not sure if it's this line or that line. So there's a lot of disagreements about locations and about the approach itself. Okay, and basically we can summarize, out of the 73 students, there are two main ones. Okay, the first one is Yang Weijie. This is Yang Weijie, and he has two students. This student's coming from Canada, and this student is American, but he's Jewish, and he's now living in Jerusalem. So I had the opportunity also to study with him a bit. Yang Weijie also came to Israel to have a seminar, and he's a great, great scholar and physician, but he's interpreted this style of acupuncture through the 14 channels, okay? Through the main channels. He's explaining the points function and how they work through the main 14 channels. But when I arrived to Taiwan and discovered Dr. Hu Wenzi's approach, I realized that this is more authentic and more accurate, okay? I won't talk because we don't have time why I came up with this conclusion and why my teacher and other colleagues and other people who are interested in this style of acupuncture came to this conclusion. But basically there are two approaches. One is this style of acupuncture is part of the 14 channels, and one is it's nothing related to the 14 channels. So what are these acupuncture is based on? Basically, it's based on the 5 Zhang system of acupuncture. So you all know the 5 zang, we have 5 organs if we exclude the pericardium, right? You all know that there is the 5 zangs and the 6 fu. There were times in the history where the heart was not part of the 5, where the heart is the emperor. There was time in the history of Chinese medicine where the pericardium was not part of the 5. Okay, so the 5 are the liver, the heart, the spleen, the lung, and the kidney. Okay, so there are 5 systems. There are 5 channels. This style of acupuncture is mainly focused on them, on the 5 Zhang system. As well, Master Dong acknowledged the 6 Fu organs, okay? But the 6 Fu organs take a lesser role in this style of acupuncture. Okay, if we think of the pericardium and the sanjiao as 2 very unique membranes in the body, okay, and then we have the stomach, large intestine, small intestine, and the gallbladder. The gallbladder is an extraordinary organ by himself, so we're left with 3 organs: stomach, large intestine, small intestine. Some disciples, some apprentices saying when you see in the point it's written the 6th Fu organ, it means it treats the stomach, the large intestine, and the small intestine. Some disciples saying when you say the 6 Fu organs, it means if the point has lung, reaction area is the lung, and you see the 6 Fu, it means lung and large intestine. Okay, because the Fu of the lung is large intestine, right? Are you here with me? Okay, so, but anyway, this is not the main thing. The main thing is the 5 Zang. Only 5 channels. Makes life easier. We don't have 12 or 14 or 18 with the 8 or extraordinary channels, right? We just have 5. But sometimes it makes life complicated because not a lot of options. So in his book, when you read the point, you read the location, you read the indication, and then you read the reaction area. So the reaction area, it's mainly focused on the 5 Zang, the 6 Fu, or the 6 extraordinary organs. Master Dong has points, Fuke here, 1124, the numeric number. It affects the uterus. Okay, the uterus is the extraordinary organ. Master Dong has a lot of points to affect the brain, okay, mainly in the leg area. Okay, many points that affect the brain area. Some points has an effect on the gallbladder as well, and bones. Some points are indicated to treat bone disorder. Okay, so this part is quite unique. Usually we don't see it in regular acupuncture points. Okay, but some points has an effect on the 6 extraordinary channel. Okay, so basically we can summarize it through this image. Okay, we have an image. We have an image of the hand. So this is the head. This is the neck area. These are the lung, heart, spleen, stomach, liver, the uterus area, and the kidney, and the reproductive organs. Okay, there is an image on the hand, also palm diagnosis. We'll talk about it later. So basically we have 5 channels. This is the lung. This is the heart. This is the liver line and kidney. Okay, and the earth is in the middle. So the earth is basically everywhere. So if I do it like this on my hand, it will be more, this line starts from here, this finger, in palm diagnosis is the lung. Okay? This is the head region, and over here also the earth, the spleen. But the spleen is everywhere in the body because the earth is in the middle. You have several areas where the spleen is in between. Okay, so this line, if you look at it in 3 dimensions, this line, the lung, like we know where is the hand tying lung channel, all of these points affect the lung. Okay? But also this part, the large intestine. Okay, so this is the lung. Now the heart is on the pericardium channel, right? The pericardium channel, a unique membrane that in the 14 channels approach, it's a channel. In mastodon's acupuncture, this is the heart line. So the heart line is here, but also here. What is that? The sanjiao. Sanjiao and pericardium are ministral fire organs, right? The heart, the fire phase is a very unique phase, right? So the pericardium and the sanjiao are two ministral fire organs. In mastodon's acupuncture, this line, the middle line, treats the heart. This finger is the liver finger, goes all the way here. And this area, where the heart area in the traditional acupuncture is the small intestine, right? And the heart is the kidney. So this is the area of the kidney and the liver. And spleen, as I said, is in between. The same happens in the legs. Okay? So it's hard to grasp at the beginning, but these are the 5 channels. Okay, in order to understand Tung's acupuncture and this system, first we need to learn and understand the points. Through the points, we can learn the system. We cannot learn it backwards. We need to learn the points first and then the system. Okay, so each point has a name. It's very important to know the names because the name gives you an indication of what the point is doing. For example, gunman, there is a point here, gunman. Gun, it's liver. Man, it's a gate, door. So this point treats the liver, okay? So it's very important to know the names. The second part is the zone. So Master Tung divided the body into 12 zones. Okay, so 1 area is the finger, 2 area is the palm, and so on. We'll go through it later on. But there is a numeric system. Okay, originally created by Master Tung. In the original book, there were numbers, but there are a lot of versions of numbers. Western style, Yang Wei Jie, the numbers are a bit different from Dr. Hu in Taiwan. So the numbers make a lot of confusion. So it's better just to know the name, okay? Location, obviously, it's the anatomy. We need to know how to locate the points. And then the indications. So as I said before, Master Tung was very influenced by Western medicine approach. So he put a lot of symptoms and diseases in the indication. The indication, basically, when we look at the indications of the point, they treat the branch, okay? For example, there are points next to stomach 36. It's 77, this 77 area, 22, 23. 这三例, 这下三例, these are the name of the points. They have indications for the head region and mainly lateral side problems. They treat facial paralysis, they treat lateral side headache, they treat TMJ problems. Why is that? Because the points are located on the side, okay? And this area, we'll talk about image in a second, this area image the head. Okay, so these are symptoms. So they treat the branch. However, in each Master Tung's point, there is a reaction area. Okay, reaction area, it means root treatment. Okay, some points, for example, in the leg here, those points, 三例, 这下三例, 77, 22, 23, the reaction area is the lung. Okay, so they can treat the lung organ itself. So if you have a patient is coming with some Qi deficiency, you diagnose this patient as a lung Qi deficiency, weakness, tiredness, or lung respiratory problems, and so on, these points can treat the root, the reaction area, okay? And methods of manipulation. Each point is saying you can needle the point, you can bloodlet the point, okay? Many, many points are bloodletted. And we'll talk about which one of them. So I think we are lacking out of time to discuss this idea of Shenjing and the reaction area. But if you see in the books that you have reflex area or reaction area. In English books, there are a lot of different translations. You just know that this is the root treatment. This is the reaction area. One of the 5 zang, or the 6 fu, or the 6 extraordinary organs can be the root treatment. However, the symptoms of the point, the indication of the point can treat the symptoms. Okay? We don't have time to talk about this idea. Okay, so treating the branch, when we treat the symptoms, a patient is coming with symptoms. Okay? So the points as indication. The indication is the most important thing, because indications are based on clinical experience. Okay, clinical experience of Master Tung, he had a lot of clinical experience, and he wrote down his experience after treating 300,000 people. But then his apprentices, you know, in Taiwan, in China, they see a lot of patients, a lot. So they get a lot of clinical experience. The indications are very important to learn them. And then according to that, you treat, when a patient is coming and has symptoms, you treat it. Symptoms sometimes are according to the imaging of the body. I just mentioned points here in this region. We'll talk briefly about the imaging part. So you can think about imaging, and through imaging you think, okay, this area is the leg, this part of the leg can treat the head, and this area is on the lateral side. It can treat the lateral side problems of the head, like facial paralysis, like TMJ, like lateral side headache, and so on. And treating the symptoms or the branch is according to distribution of the channels, but not the 14 channels as we know, all of us. Those channels that I mentioned now. So if we look at the heart channel, the heart channel treats medial side problems. Okay, because this channel is on the middle. For example, you have a osteoarthritis of the knee patient coming, and his pain is mainly in the medial side of the knee. So you can treat the point next to liver 3. It's 6804. Huozu, we'll talk about this point, because the line of distribution is to the medial side. If the patient has lateral side problem, you'll choose gallbladder 41 or a point of Master Tung close to it to treat lateral side. Okay? So according to the line of distribution, you can treat the symptoms. But the magic about this style of acupuncture is the root. And what makes this style of acupuncture to be unique is that the point themselves represent 2 ideas. One is the indications and the symptoms, which treat the symptoms, but then, according to your diagnosis, you treat the root treatment. Now, Master Tung, he barely take the pulse, and he didn't use tongue diagnosis. Okay, he mainly used palm diagnosis. Okay, so this is a map. There are several maps for palm diagnosis. This is one of the areas. So as you can see, this is the lung area. Here it's the small intestine, large intestine, the rectum. So this is digestive system, but also this is considered to be the head. This is the heart. The spleen is here, liver. This point, you see the spleen is in the middle. So this is the heart finger, but the spleen also represented in the middle. This is the liver finger, but you have also points here to treat the spleen. This is the reproductive organs. You need to learn the map in order to diagnose. Okay, so you look at the palm. Okay, this is another seminar to understand how to use palm diagnosis. Okay, so he mainly used that. However, you use what you use for your diagnosis. You take the pulse, you look at the tongue. Regardless, you just get to understand what is the diagnosis, what is the problem in the patient, and then you can treat the root. Okay? Another way to treat the root is to know the names of the points. A point who has shui, water, will treat What? Will treat the kidney. Simple. This style of acupuncture is unique and produce really good results quickly, but it's the basic of it, it's simplicity. Okay? So, for example, Huozu, I mentioned this point. Huo is fire. So, Huozu 6804, just next to liver 3, will treat who? The heart, not the liver. Okay? It's a great point to treat the heart. We'll talk about it. Okay? Gunman, for example, will treat the liver. So therefore, it's important for you to know the names. Okay, so Master Tung divided the body into zones. Through each zone, you can image and treat the entire body. Okay? So this idea actually is the Zhenjiu Jiaijing, the ABC systematic of acupuncture, the first book after Su Wen, Ling Shu, written like 1700 years ago. They also put the points according to zones. Okay? So through each zone, you can treat the entire body. So 1 zone is the fingers. You can treat the entire body through the fingers. 2 zone is the palm. You can treat the entire body through the palm. So what does it mean? It means each zone has the 5 zang channel. Okay? So 3C area is the forearm. You can treat the entire body through the forearm. Okay? So these are the 12 areas, the 12 zone. 1 zone, fingers, 2 zone, palm, hand. 3 zone, the forearm. 4 it's the upper arm. 5 it's the plantar area. 6 is the dorsal. 7 lower leg. 88 the thigh. 99 the ear. 10 it's the head. And then 11 it's the dorsal trunk and the ventral trunk. Okay? The dorsal trunk and the ventral trunk, we don't needle. Master Tung barely needled this area. He bloodlet this area from a safety reason. Okay, so the back area we treat a lot for bleeding. Okay, to my opinion, the 1 area and 2 area is a very unique area. Usually, it's more treated for acute conditions. Okay, but 1 area. Have you heard of Sojuk, Korean? Treat the entire body through the hand. It was very much influenced by this style of acupuncture. 1 area and 2 area is a very unique area. There are a lot of nervous system in this area. Okay, it affects the brain very quickly and strong. Okay, another very unique area where we don't have barely any points in the body through the 14 channels is the 8-8 area. There are a lot of points in the 8-8 area, in the thigh. A lot of points that they treat, the best, they treat the root. They treat the organs. Okay? So this style of branch and root idea, this style of work brings a lot of creativity in clinical settings. Okay, you choose points according to disease symptoms, according to the indication. You choose points according to the image, which we'll talk now, and then you choose method of points. You choose the method of needling. Sometimes there are points that we can bloodlet. And then the last is you choose points according to diagnosis. So I'll give you an example. I never treated heart problems. I don't have a lot of experience with heart problems. And then a patient is coming with pericarditis. Suddenly I'm like, what should I do with it? And it's quite easy, okay? So the 8-8 area has points to treat the heart. This is system number 4. We will talk about it in a second. Okay, and then 330405, system number 2 is to image. These are points on the Sanjiao channel, but this is not Sanjiao, it's the heart. We know it's the heart. And then we can bloodlet the area on the back that treat the heart. Okay? The upper part is treating the heart. And then on the other forearm, I choose Chinling points. It's close to Neiguan, pericardium 6. It's treating the heart, obviously, pericardium 6, right? Treat the heart. And in this area, 770809, it's the 4 flowers, Sihua points. It's in the middle. Middle, treat the middle part. So these points have an effect on the stomach. They are close to the bone here, just next to stomach 36, but they are on the middle part. So the reaction area has heart. So these points are very good to treat the heart. If you see a vein there, you can bloodlet it. Okay, and then for this protocol, you take the pulse, you look at the tongue, you see the root problem of the patient. You see more Qi deficiency. You see more access type, Qi stagnation, fire. You decide that besides of the problem of the heart, there is another problem. So you add points to that. Okay? This is for you at home. You can go through different points that treat different organs and extraordinary organs. Okay? Let's talk about imaging. Imaging is a very important part of this acupuncture, this style of acupuncture. So it all starts with this Tai Chi hologram idea. So we call it Tai Chi Chuanxi in Chinese. Chuanxi means hologram. Okay, I don't want to talk too much about where this idea comes from, but it has roots in the I Ching, the Book of Changes, and basically in Chinese medicine, this idea of imaging already exists. When we take the pulse, we have the upper burner, middle burner, and lower burner. When we take the tongue, we have imaging. The same, upper, middle, lower. When we look at auricular acupuncture, we have imaging idea. This idea of imaging that was developed in Song Dynasty is already rooted in our regular acupuncture, okay? So, as well, we can try to understand points, function, and indications, and how to use points according to imaging principles. So this style of acupuncture is very much influenced by this idea. Usually, we use points in a distal manner, okay? There is a problem on the head, we won't needle the head most of the times. We will affect the head through other areas, okay? So it's a distal approach of acupuncture. As well, this idea of Tai Chi hologram exists already from the simple question from the Su Wen, chapter 63, talks about treating the corresponding area of the opposite side method. In Chinese, it's miao ci. So we have a problem in the shoulder. We treat the upper side we treat the hip. So we have right side shoulder problem. We can treat the left hip to affect the shoulder. Okay, these ideas are existing in the Su Wen. And balance method and Richard Tan was very influenced from that. We have a problem in the elbow, we treat the knee, opposite side. We have a problem of the wrist, we treat the ankle. We have a problem with the hand and fingers, we treat the foot and toes. Lumbar and back, abdomen and chest. Okay, front and back, the same. Okay, so this idea of imaging in Master Dong's acupuncture goes further. Okay, it becomes a bit more complicated. Okay, so first of all, first image that we have the upper limb and the lower limb. Okay, so right limb treating the left limb. We have a problem. We have tennis elbow in the right. We can treat points on the other elbow to treat on the left. So the problem is on the right. We treat the points on the left. And as well, we can do a reverse imaging of the limb. Okay, so we have a problem in the shoulder. The area of the palm will treat the area of the shoulder, okay? Because we can reverse the limbs, left and right. The same equivalent to the leg. Okay, we have a problem in the right knee, we will treat the left knee. And we can do a reverse. Okay, so a problem in the thigh area can be treated with the leg, with the toes area. Now we are stepping for the limbs and the torso, okay? So we have a problem. We have a problem in the head, so we can choose points in the fingers area, okay? Or the shoulder. Chest and epigastrium is this region. The navel is the midline, okay? Is the elbow and knee. The lower abdomen and waist is the upper arm and the forearm, depends if it's reversed. The genitalia area is the fingers or the shoulder area. The shoulder area, 4-4 area, here there are several points with a lot of gynecological indication. You look at this and it's like, why there is gynecological indication over there? Like leukorrhea and other gynecological problems. One of the way to explain it is through imaging. Okay, so the same with the limbs. Okay, so far there is any questions?
Why would you choose the reverse or the way you have to? So what would be
When? Great question. Great question. First, based on experience, you're trying things and you learn by trying. And some areas has, now we'll go to the next image, some areas has several images. So several images, they are kind of like stronger to use. Exactly. Exactly. And from previous experience, because basically in the end, we learn from teachers, we learn from people who have experience, and then we apply it on the clinic. So we learn from our own experience, we are trying, but also from others. Okay, now things start to be more complicated. Okay, each bone can image the entire body. So one bone can image the entire head and torso. Okay? So that's the idea that one area can treat the entire body. Two area can treat the entire body. Three area can treat the entire body. So let's see an example. The 3-3 area, it's the radius el ulna. So this area, the beginning of the head of the bones, is the head region. And then the lower part is more the navel area and the lower belly. So here you have points that treat the intestines, okay? Because this is the area of the intestines, okay? You have a lot of different ways to make the image, but one bone can image the entire torso. So obviously, now you should ask like a question, but there are so many different types of imaging. How can you know what to choose? And basically, this tiny finger, this part of the phalanx, can treat the entire body according to this idea. Would you choose this entire, this small? It sounds funny, you know, I react the same, like you. It was crazy for me. But basically, the rationale that the small can treat the whole. That's the Tai Chi idea, okay? However, it will be very difficult to treat a small area like this, the entire body. So we use bigger areas, and we use areas where there are previous experience, like there are many indications that indicate this area, okay? There is an image of the foot. So here, there is a point, mu, fu. Mu is a wood, and fu is female. This point here has indication for gynecological problem. So this is the area of the reproductive area. It's a great point for that. Huo Bao, for example, Huo, treat the heart. This point has indication to treat heart problems because it's in the upper part of the body. Through imaging, we can try to understand the point's indications. Now, this book is Dr. Lee's book from Taiwan, and his way to explain the points and the indication of Master Dong's points is through imaging. Okay, mainly through the imaging idea. Okay, for example, this image, this line, liver 3 is here, Huozu 6804, Huo in 6803, they treat the heart. This is stomach channel. In Master Dong Menjin, this line is stomach. This is liver, and this is kidney. Okay? So the way to start to understand it is to learn the points and their indication and to start to use it. Okay, as well, there is the image for the head. So here there are points, Shui Jin, Shui Tong. These points treat the kidney. Shui is water, but Jin is metal. These points are really good for asthma. Patients who have chronic asthma, lung and kidney Qi deficiency, these points has indication, a lot of indication for asthma. So we can understand it through reverse image of the head. Treat this region. Okay, it sounds crazy, but it works. It really works. And it's a different approach for acupuncture. So in summary, we have 8 types of Tai Chi. Right limb to left limb, reversed right limb to the left limb, upper limb to the lower limb, reverse upper limb to the lower limb, and then torso to the limbs, reverse image of the torso to the limbs, and then image between up and down. For example, kidney 1 area can treat the head, GV20, okay, and image between front and back. You have a patient who has a back problem, but you use points. It's lying on the back. So you treat points while he's lying on the back. So you can needle the area of the belly to affect the back. So for example, GV3 will more or less will be like CV3. GV4, Mingmen point, Mingmen Xue, Guanyuan Xue, CV4 will affect that. So we can affect the back through the front. Okay, and then it becomes even more complicated. Imagine all the people, we're in England, right? So I had to put the Beatles here. But here, there are points named San Jian. San is 3, Jian is shoulder. Look at this image. 2 fingers like this. So this is the scapular area, and here it's the shoulder. So this point is Jianning. Jian is shoulder in Chinese. This point is a really good point for shoulder problems. Okay? So Sanjian can treat the neck and the shoulder, the scapular region. Fabulous points. I swear. I use Sanjian all the time. They are great points, and I could never understand why they treat the neck and upper back and shoulder. But through this image, we can understand. As well, there is an image, the turtle image, this one. Okay, so the turtle image also explains Jianning effect on the shoulder. Okay? Here, Sansha Yi. This is similar. The idea here that similar treat similar problems. So Sansha Yi can treat the anus region. Really. It's not a joke. Okay, very, very important part of this style of acupuncture is Daoma. Okay? Daoma basically means Dao, Dao. It's fourth tone. Daoma. Okay? Tao is like to fall over, to lie down. And Ma is the horse. Okay? And then Jian Fa, it's needle technique. Tao Ma Jian Fa in Chinese. So basically you want to flip the horse. So the horse is falling down and we want to pull him back. It implies the techniques of activating the qi. Okay? In this style of technique, we use several needles. Okay? Usually, it's between 2 to 5. The most common one is 3 points. Okay? And we do it because we want to turn upside down the horse in order to increase the qi flow. Okay? Basically, in Mastodon's acupuncture, there is no needling technique. There is no tonifying or reduce. There is even technique. We put the points, we get some dead qi, and we leave it. And in order to reinforce the movement of qi, we are using 3 points usually. So this is a Dao Ma. So the book of James Mara that I mentioned, it's only about Dao Ma combinations. Okay, so for example, Xinling, next to pericardium 6, Xinling E first, R second, San third, means 3 points in pericardium 6 area. We'll see the location in a bit, but it's 1.5, 2.5, 3.5 soon from the wrist. So it's a Dao Ma set, okay, of 3 points. So we don't use other methods of techniques in the needles. We just use more needles, okay, and it's very, very effective. One of the most effective things about this style of acupuncture is the Dao Ma idea. So the rationale for it, Master Dong said he believed that chronic diseases, chronic illnesses give rise to rheumatism, to Bizen. So in order to activate the qi, he used 2, 3, sometimes more points in a certain area. Now think about it. This is a method of zones. This is acupuncture style is zone idea. So 1, 1 is a zone, 2, 2 area is a zone. And when we do this Dao Ma, there is a holistic idea of 3, right? Ren. 3 is Ren. Okay, so we treat the entire body like that. Okay? Also, he noticed from extensive research that using Dao Ma can unblock and effectively promote free flow in the entire body. Okay, I really like Dao Ma idea. Even in 1 area, you'll see photos and I can show you. I needle 3 points. It's not that painful. 98% of my patients get it very well. So it's more points, but I'm not treating points. I'm treating zone. Okay? So the most common one is 3 needles. Usually there are many points. You saw it before, like Sanjian. Sanjian is 3 points. 1, 2, 3. It's a Dao Ma. Okay? It brings this holistic idea of 3 to promote the free flow in the 3 burners, in the upper burner, middle burner, and lower burner. Okay? It activates the qi, as I said, and it's a way to treat the zone and area, and not specific point. Last sentence, this technique has strong roots from the past. Unfortunately, I don't have time to talk about it, but in Madang Yang, in 1972, they discovered 11 channels. No points were mentioned, only channels, only line. And this idea of Dao Ma, it's an idea of lines in the body. So there is a debate. What was first? First was points, or first were channels? And Madang Yang, in 1972, they discovered this tomb, right? And they found 11 channels. No points were mentioned. So Dao Ma represent, perhaps Dao Ma represent this idea. In the 14 channels, we have 1 area that represents this idea, heart. The heart channel, heart 7, heart 6, out 5, out 4, very, very close to each other. Now, how they needle 1,000 years ago? They used bien stones, or very sharp stones. They took those bones to needle. So they used to do zone treatments. They used to do kind of like gua sha. 1,000 years ago. So Dharma represents this ancient idea. Okay, and there is more to talk about it, but unfortunately we don't have time. I hope you understand my meaning. Okay, so there are three main types of Dharma. There is the continuous wave, the continuous one, transverse, and triangle. The continuous is the most common one. We go on one line. For example, I mentioned Xinling. So Xinling is continuous, right? It's on the heart channel. So this is an example. These are a few points on the 8-8 area. So this is treating the kidney. This one treating the heart in the middle. Okay, so it's continuous line. Okay, then we have transverse. Means there are several channels involved. Okay, there is 3 channels going. For example, this is Yaoling points. Yaoling points are excellent points for hemorrhoids, for constipation as well. There is an image, I didn't show you this image, that this area is basically the middle. We start the middle of the... So Yaoling points are very, very good, and it's transverse Dharma. Very, very good points to treat hemorrhoids and constipation. And triangle is basically, for example, you see this is 7708. Sorry, I keep coming up and down. 7708 is 四花香, 4 flowers, the upper one. So it's here. Stomach 36 is here. This is very close to the bone. And then here it's Sanli, 7722, 7723. So this is a triangle of Dharma. This is also considered to be a Dharma. Another example from the 14 channels, gynecological treatment like CV4 and stomach 28. PCOS, for example. This is a triangle, right? So triangle Dharma, it's another Dharma. It's less common, but this idea of 2 channels, okay? Another very important part of Master Tong's acupuncture is long retention of needles. Yesterday I had a conversation with a colleague from the Netherlands, from Amsterdam, and I told her I had a patient with COVID, and she was exhausted. Originally she came to me because of migraines in her menstruation time, and she was exhausted, and I had time in my clinic. And I told her, listen, you're in a rush. I have some time. She says, no, I'm not in a rush. I left the needles for 1 hour and a half. She was very deficient and was coughing all the time. So I left the needles for long retention of time. Now this guy, Leo Luke, do you know him from a Facebook group? He's a great scholar. Okay, so he has like a podcast you can purchase very cheap. In only $10, you can purchase a recording of classes he's doing. Please do it, support his work. He's a great scholar. So he brought some evidence that there is some recordings that were found in Madang Yang in that 1972 discovery, that there are texts that shows that we can leave the needles for about 40 minutes. Okay, so we leave the needles for 25 minutes, 30 minutes, more or less, averagely, in China, in Taiwan as well. But over there, it's because of practical use. You know, they have so many patients, so many people to treat. But in the West, we formed this idea as well, 25, 30 minutes, more or less. Usually, follow-up treatments, for me, I see a patient 10 minutes, I talk with him, do diagnosis, I palpate, I put the needles for another 40, 50 minutes, totally 1 hour. This is average. Now, I asked my patients, is it okay with you? Because some patients are anxious, they want to finish already, but some of them are just, you know, very relaxed, and long retention of needles, it's a key aspect of this style of acupuncture. Dharma, the principle of imaging and how to understand the indication of the points, bleeding, and long retention of needles. Are we okay with time? For break? Okay, wow, okay. So next part is the bloodletting. Okay, bloodletting is part of Chinese medicine. It's not Master Dong's idea. Bloodletting is part of Chinese medicine. Unfortunately, we don't use it so much, and it's a pity because bloodletting is so effective. Really, it's like a magic. Bloodletting is a magic, and it's safe. You can bloodlet anybody. If it's deficient patient or chronic, if it's a deficient patient or access patient, obviously access, right? Because it's clearing heat. There is some Ting clearing heat property effect. But bloodletting we can do for everybody. We just need to know how to do it. Okay, so there are records from the classical text that bloodletting is part of the 9 needles. The 9 needles in the Ling Shu. There are 9 types of needles. Few of them were for bloodletting. Okay, bloodletting is crucial tool for acupuncturists. Acupuncturists, we use needles. We use moxa, not in this style of acupuncture. But I love moxa. I don't use it a lot now, but it's really effective. And bloodletting and other tools like cupping or gua sha or mainstream acupuncture, electro, and so on. As acupuncturists, if you use all of those tools, you get the better results, I promise you. And you don't need to be afraid of using bloodletting, you just need to know how to do it. And the rationale for it, for chronic or even acute, but chronic obviously, that long-term illnesses enters the blood. Okay, and then we need to bloodlet the collaterals. Okay, this idea of collaterals. Now in Master Dongs, we have only 5 channels. It's a simple approach. But we know that we have 4 types of channels, right? We have the main channel, the Jing Mai, Luo channel, Luo Mai, the collateral channel, the TMM channel, the sinew, and the divergent channel. So when we are bloodletting, we are affecting the collaterals. Okay, this is a topic that we need to learn separately. But there are many areas that we can bloodlet. The occipital area, bladder 40 area. Bladder 40, I bleed. In one day, I bleed it several of times. And bladder 40 area is huge. When you see veins in the area of bladder 40, spider veins, it's an indication to bloodlet. It's fabulous for low back pain, for spine problems, for neck pain, for hemorrhoids, for insomnia, for skin problems, for so many things. Okay, so there are maps that need to be learned. And if we see veins, it's a kind of diagnosis. We look at it, and then we treat according to the indication. The tools, I use usually a 18-gauge syringe needle for the big areas, okay? And I use this regular lancet and I put it with a bleeding pen, okay? And then I can bleed the back, for example. And I use cups sometimes. So a wet cup, this is an example of the wet cup. This is the Pa Liao. Pa Liao, the sacrum area. In gynecological problems, the neck area as well. This was for anosmia, loss of smell and taste in a COVID patient. I bloodlet in Tung area, it's not in Tung, another point of Master Dong, and Shangli, it's another point of Master Dong, for anosmia. This is the back area, very good for osteoarthritis of the knee. Bladder 42, 43, 44. And large areas. This is lung 5 area. Lung 5 area in COVID patients, sometimes just have a look. Sometimes you'll see veins over there. Okay? I had a patient with COVID. She was coughing for 2 weeks. She came. I wanted to needle this area, and then I saw a vein. So I told her, listen, in acupuncture sometimes we use a different needle. I'm going to prick. It won't cause you any pain, and a few drops will fall. She said, okay. I prick it. Suddenly, I don't know if it's placebo or not. Suddenly she was like, ah. 2 days after, she sent me a message. I went back to Israel. I feel so much better. I'm not coughing anymore. I have a lot of energy. I don't know if it's only the bloodletting, but I saw vein. It's a diagnosis. I observed the channel. I saw the collaterals coming out. I prick it, okay, as a treatment. Okay, this is bladder 40 area. Also, I told you before, 4 points, the 4 flower points. These points are bloodlet oftenly. So you need to learn the points. According to the points, some points said you can bloodlet. Those areas you bloodlet only if you see a vein. If you don't see a vein, you don't bloodlet. Okay? Yeah. No. Spider veins. This is not a cosmetic treatment. Yeah. No. Okay, this is an example for the BAcC. The BAcC is usually just 1 drop coming out. Okay? Now, this is the very important part. Okay, according to Dr. Li Guozheng, there are 4 treatment principles. Okay? The first one is local. What does it mean, local? Because it's a distal approach, distal acupuncture approach. So when we treat local, we bloodlet. Okay? So a patient is coming with a knee problem, you can bleed the knee. Or you can bleed areas that are related to the knee. In Master Dong, many of the points that affect the heart also have indication for the knee. So you can bloodlet bladder 23, 42, 43, 44 for chronic O knee. Okay? Or you can bloodlet locally. Second is active qi. We call it dong qi. So there is a problem in the elbow. Pain is the most easiest to explain it, but let's talk, let's say there is a patient with acid reflux. I have a case explaining acid reflux. I'm telling the patient to think about this area, to imagine her esophagus. So active qi can be by moving the limb in pain disorders. So the easiest to understand, tennis elbow, I will needle the other side, and I will tell the patient to move the area. Moving the area it calls active qi. We can do it only because it's a distal acupuncture approach. Okay, and then he moves it. But there are other ways to do an active qi, which is to guide the qi to the area, is the intent. Okay? We ask the patient in internal medicine disease, I ask them to image, to imagine this area and to think about it. This also brings the qi to the affected area. And as well, we can massage. We can massage the area. This is similar to moving. Okay, so this is the first approach, local. Then the second approach is you choose an imaging from all the options like you asked, like you said, which is the best option. For example, this area, image the head, it image the thigh, it image, reverse imaging, the shoulder area, image the lower genital area. So it has few options, okay? But if you take only this, not the entire limb, if you take only this part, the upper arm, so this is also the head, so it has 2 options. So here there are points that can treat the head. So you treat image, and you use it on the contralateral side. Okay, so the problem is on the left, you treat the right. The problem is on the upper part, you treat the lower part. Okay, and then the third principle is the channel distribution. So as I mentioned before, a knee problem, on the medial side, I will choose medial points. Okay? And then the last is the root treatment. I want to treat the organ. Okay? So this is the reaction area. This patient is a qi deficiency type. I want to, in palm diagnosis, I see veins in the lung, or I take the pulse and I see that it's lung qi deficiency. I will choose points to treat the lung. Obviously, systemic bloodletting is always important. Use Dauma and put the needles for a long period of time. I promise you, you'll get good results. Let's take an example. Okay, knee is very easy to explain. Right side knee problem. So I will use system number 2. 2 shui points. 2 is earth, shui is kidney. These points, we'll talk about them later for acute and chronic gastritis, but they have in the imaging idea, they have indication for knee. I remember I played in Taiwan, I played basketball, I hurt my knee. I was really in pain, and I have 2 kids, and I was like, what am I gonna do now? How can I take them to school? I was so frustrated. I needed 2 shui points myself. Xinxi, it's here, 2 points, and Dan. So Xinxi is here, and Dan is here. After a day, the pain was gone. I couldn't believe. I'm a very skeptic person. I couldn't believe. And I'm using it a lot with OA patients, and it's working. Okay, so these 3, it's an image of this finger, middle, treat the middle, right? The middle finger. Treat the hard points, treat the middle. These points, xin, xi, xin, xi, it's knee in Chinese. They have indications for the knee, and they image this area from the small Tai Chi, okay? And Jian Liu, it's the 6th shoulder. In Master Dong, this idea of similar, treat similar. In Master Dong, there is an image, shoulder to the knee, not shoulder to the hip. Shoulder to the knee. Points on the knee can treat shoulder problems. Shenguan 7718, it's a very good point for knee problems. Okay, and the opposite. Okay, and so I did it all on the other side. So this is system number 2, right? Imaging. Then the line distribution, system number 3. If the point is on the middle, the problem is on the middle, I'll choose Huozu 6604, okay, to treat medial side problem. This is system number 3. Now the diagnosis part. I take the diagnosis, I see this patient is a kidney insufficiency. So I use points on the thigh area to nourish the kidney, because the kidney treats the bone. Simple, simplicity. And then system number 1 is bloodletting. So bloodletting I can do either locally or at the back. This is a complete treatment. Now, this can be applied in internal medicine the same way. Okay, other theories from other apprentices. Dr. Yang developed a lot of theories. One of them, which I really like, is guiding point. So guiding point, we are using the shoestring point. The activation of qi is stronger in these points. Okay, you know, the Jing Well, the Ying Spring, and then the shoestring. The shoestring, the qi is flowing stronger. So he's using the shoestring points as a guiding point for the affected disease. So it's very similar to what I just described. I described the system number 3 as the lines that going to the affected side of the limb. Okay, so Yang Wei Jie will use liver 3 or gallbladder 41 because they are shoestring points. But I like this guiding needle a lot, this idea. Okay, a patient has a spine problem with or without sciatica. If it's with sciatica, and the sciatica it's on the posterior side, so I will use bladder 65 as a guiding point for the sciatica and for the pain. Okay, I will treat the spine. I will treat points on the other side to treat the spine because this is the root of the problem. But then as a guiding point, I will use the shoestring points. Okay? Any question about that? About the shoestring point? Any questions in general? Why I put the dash?
No. Why two numbers?
Because this is 2-2 area. So it's 2-2.
I see, but there are 12 areas, right?
Yes.
So why don't you use just 1, 2, 3, 4 instead of
Because this is how they use it. They call it in Chinese.
Not because it's bilateral or something like that.
No, they just wrote down 2-2, 1-1, 3-3. This is how it was called, so I'm following the... Yeah. Sorry?
sometimes you have to practice on the way.
Yeah.
Because if people are paying a lot of money, I feel uncomfortable about practicing stuff. So I messed around with doing simple things to this.
Yeah.
For example, she had the Quavens and the sinusitis, very bad pain in the thumb, very severe pain.
Yeah.
And using local channel points wasn't working very well, using Moxa, using electroacupuncture.
Yeah.
So I thought, right, we can try the opposite side, we can try the wrist ankle needling, which is a long decline. But what I was doing was palpating to find tender spots on the opposite side, which there were tender spots, and I needed them, and those worked quite well. So I was being guided by BAcC, in a sense, but you haven't mentioned BAcC at all.
True.
Points. I'm wondering whether this is also BAcC-based stuff.
Very good question.
That would give us freedom to use it with a bit more confidence than just buying into a system.
Very good question. I like this question a lot because I'm thinking about this question. I don't like, frame systems that this is the rule. So this system of acupuncture provides a lot of creativity. First of all, what you're saying is similar in a way that you can use the local approach, the bloodletting, especially if you see vein. Okay, if you see a dark vein. Sometimes part of the local treatment is bloodletting the local area, which is similar to BAcC idea. Okay, now Mastodon usually bloodlet the 11, 11, 12, 12, the torso area. But as I said, you can bloodlet locally, and bloodletting is a very effective method in senior channels. And sometimes, some cases, I'm using other approaches. I'm using more like a trigger point idea. Sometimes it has limitations. In the clinic, sometimes you meet patients that it's not working. You're doing this imaging and distal approach, acupuncture, and it's not working. Sometimes you need to do other things besides that and do BAcC points in a sinew treatment. Sometimes it is working very well. But in this style of acupuncture, usually the local approach is to bloodlet.
But with the distal points that are in this tongue system,
yeah,
do they become tender with pressure usually?
Very good question. Sometimes the rationale says the problem is on the left, you treat the right, right? However, sometimes you go and palpate the 2 points on both sides, and you see that the problem is on the left, but the left side, on the limb, is more tender. So according to what you say, and also according to my experience and my teacher's experience, you will treat the most tender one. There are other ways also to find out which points are active. And yes, for your question, if the other side will be tender, needle this side, and check. We are always checking. That's the beauty about this style of acupuncture, that we are doing active qi to move. We expect immediate results. Okay? Is it time for a break? 2 minutes. 2 minutes. Okay, so 2 minutes. I'll give you quickly another example. We'll talk about it later. This protocol, it's a very good protocol to affect the spine. I treated many cases with herniated disc, bulge disc, spinal stenosis with good results, really good results. Okay, so the problem is in the spine. So we want to treat the spine. Okay, so first of all, system number 1, bloodletting. When a patient is coming with back problems, the first thing I'm doing, obviously I will check him and try to understand where the problem is coming, but I will go to look for veins in bladder 40 area. You don't believe how much it's like a magic. A patient is coming with acute sprain. He's coming to the clinic like this. I immediately go and look to see if he has veins or not. If he has a vein, I prick it. Many times, immediately, it's like 80% or even sometimes 100% better. Second, to treat the spine is do 19. This is coming from Dr. Wang Jui in Beijing. Do 19 over here with a 0.40 needle, 1 cun and a half, long needle, in all the way down. very effective to open the do-my channel because the problem is in the do. And then, if he has sciatica in one of the legs, I will treat the other side. I will treat the spine. So this is system number 2. Image the spine. So Zhangji points here. Their indication is spine. Their reaction area is spine. They treat the spine. Okay, we talk about extraordinary organs, it's bones. So there are points in Master Dong that treat the spine. Fei Xin, it's here. Okay, they treat the spine. Jiao Ming, it's 1-1 area, they treat the spine. And Wan Shun points close to small intestine 3, opens the Du Mai, right? So Wan Shun E, Wan Shun R, 22-808-09, they treat the kidney. The kidney controls the bone, the spine, they treat the spine. Okay? System number 3, this Dharma is coming from James Meyer's book. It's 6801. Okay? It's bladder 65, bladder 62, and bladder 60. Okay? The Dharma is 6801. Now, very important with numbers. When you see a dot, it's a number of a point. Now, the best, don't learn the numbers, learn the names. But when you see a dash, it means it's a Dharma number. Okay, so this Dharma number from James Meyer book, it's bladder 65, 62, 62 Yang Chiao Mai, okay, with small intestine 3, right? Wan Shun, very close to small intestine 3, and bladder 60. Okay, and then, if we have a radiation on the lateral side, I will use the guiding point, gallbladder 41, the shoestring point. He has sciatica on the left or on the right. So I will put on the affected limb, I will put the shoestring point. And then last, but not always, I'm not always doing that, system number 4, in pain disorders, I'm not always doing that. In pain disorders, I will add, according to the diagnosis, I will add in the thigh area the points to treat the root problem. So if I think this patient is kidney deficiency, I will add points to treat the kidney. If the patient is more like lung qi deficiency, I will choose Sima points. 88, 17, 18, 19. Sima points, treat the lung. Okay, because I want to treat the root problem. This is a very good protocol for spine. Lumbar problem or even cervical. If it's cervical, this is more for lumbar, herniated disc in the lumbar region. If it's cervical, we need to modify it a bit. Okay? I think we can take a break. Thank you for your listening. Let's start to talk about the points. This is, I don't know if it's easy, but yeah. Okay, so zone number 1. So as I said before, each of the 12 zones, we can treat the entire body. Each bone can treat the entire body. But we want to make our life easier. Okay? We cannot use the phalanx, the distal phalanx to treat the entire body. In the principles, we can, but it's impossible. So we are using several areas. But one area, it's a very unique area. It's a microsystem, like auricular therapy. One area, it's a microsystem. Also 2-2 area. Palm diagnosis is here. 1 area and 2 area is unique areas. Mainly used for acute conditions, but you can use it in general. So most important, when you use 1 area, is obviously small needles, 15, 16. You can pass. Yes. Okay. And you can use Prestec. The one in the ear, you can use Prestec. For sensitive patients or for treating yourself. I'm using Prestec to myself all the time. Okay? Most important, don't be afraid. When you're afraid, you don't needle good. Okay? The patient, when the patient is coming and you are afraid to cause pain, you will cause them pain, for sure. So practice Practice a lot and don't be afraid. And obviously you cannot use a guide in this area. So you need to practice on your needling technique. But look at this, for example. 6 needles in 1 finger. No problem. And I'm not needling so well. Okay, let's talk about the points. So the first point is called finger earth 3 needles. So the English translation for the Dharma is coming from James Miles' book, finger earth 3 needles. So this point name in Chinese is Tung, to correct the earth. So this is why I call this seminar Correct the Earth. Okay? The zone is 1-1, and the number of the Dharma, not the points, is 11-18. So it's these 3 points. Okay, not these ones. These 3 points. Okay, the source of the point is Hu Wen Zi. I won't go and talk about all of the points because we don't have all of the sections of the points because we don't have enough time. Okay, in terms of palm diagnosis, this finger is the which organ? Liver, right? So it's a liver finger. However, we have a section of the spleen. So these points will be good when we have spleen, liver problems. Okay? Because the reaction area of the points is the spleen. But they are on the liver finger.
So is it significant that holographically this would be the middle jiao?
So let's see it now. Okay? In terms of needling, it's usually the fingers, it's 0.2 or 0.3. It's very superficial. Okay? We don't go deep. That's why press tech is enough. Okay, so you divide these phalanx into the middle, and then the middle part is the first point, and then in the quarter is the second and the third. So it's Zhang to Yi are San, 1, 2, 3. Okay? Important to mention these lines. Okay, so this is the finger. Okay? This is the radial line. This is line A. Then in the middle, this is C. The radial line here, just next to the bone, is B. The ulnar line here is D. And then on the side, it's line E. Okay? When we practice, you get it. It's very simple, but you just use James Meyer book and this explanation. Okay, so these points are on line B. Okay, so in terms of imaging, straight image treats this area, and reverse treats this area. Because the finger image the entire body. Okay, and this is an example how to needle. This is straight, this is perpendicular, but just because of the angle, to catch the points, you see it looks like not straight. So these points are really good for abdominal pain, gastritis, vomiting, also small intestine inflammation. These are the key main indications for the digestive system. You can think about these points also to use migraine headaches. I have experience using these points for migraines. Okay, also asthma. There are other points in Master Dong's acupuncture here that are called Ding Chuan, asthma. So sometimes asthma, the liver is involved because there is liver qi stagnation. Okay, I won't go all the combination, but you have the combination. Okay, when you see the dash, it means it's a Dharma number. It's coming from James Miles' book, and some of them are also my suggestions. So to treat UC, for example, all of these points we will learn today. All of these Dharma combinations.
Question.
Yeah.
You're on needling 3 needles. Any sequence? Middle one, second?
Great question. And why you ask this question?
Because I know. It's a good
Because you learned with Yang Weijie.
Yeah.
From Taiwan's approach,
Yeah.
from Dr. Hu and Dr. Li in Taiwan, no sequence.
Okay.
You put it 1, 2, 3.
Yeah.
That's the answer. Okay? Okay. So these are the finger earth 3 needles. Okay, correct the earth. We'll treat mainly spleen, liver problems. Okay? Any questions?
It doesn't matter which side or both sides.
Good question. For what? For migraine?
That's right.
Migraine left,
Okay.
you treat the right. Abdominal pain?
Maybe.
没关系, doesn't matter the side. But maybe you can try to see sensitivity, but it will be hard in the points here to see sensitivity. Do you know what VAS is? VAS for auricular acupuncture. You take VAS, you take the pulse, you stimulate some point with a device, and you take the pulse in a different way. You don't know what VAS is? No. So it doesn't matter. But you can do a pulse to see if a VAS, to see if the point is active. Okay, but forget what I said. If it's a pain problem, on the other side. If it's internal medicine problem, doesn't matter which side. Next point, finger 3 spaces. So the name of the point is 大剑, 小剑, 射剑. Okay, 剑 in Chinese it's a space. This is why you call it. You don't need to take a photos. I will send you the PPTs with love. You get all the information. Okay, you don't need to take photos. Just be focused because we don't have time. Okay, the organizers will send you the PPTs. You can contact me afterwards, and I'll give you all the information. Okay, focus on me speaking fast. Okay. So the number of this Dharma is 1104. It's quite confusing because the regular numbers of these points is 1101, 02, 03. 0.03, 0.02, 0.01. So the Dharma with the dash, I'm repeating it the third time I'm saying, the dash means James Myers, the book that one of the sources for this lecture. It's the Dharma's number, the sequence of 3 points. This is the Dharma. But these points are also in the Tung's original book. Okay, so it's simple. This is on line B. Okay, this is the middle. You divide. The middle point is the first one, second one, and third one. Okay, these points, the reaction area, this finger belongs to who? Lung, not large intestine. We don't have large intestine. Sorry, large intestine, but you do not exist. This finger is lung. Okay, but also the heart. This point has indication for the heart. And they mentioned the 6 bowels. So some apprentices, they say 6 bowels. So if it's the lung, this point treats the large intestine. If it's the heart, this point can treat also the small intestine. And in Taiwan, I learned, because it's the 6 bowels, 5 tongue, 6 fu. 6 fu is 6 bowels, right? So heart, the fu of the heart is small intestine. Lung, the fu of the lung is large intestine. But I learned in Taiwan, when I see the 6 bowels, the 6 fu, it means these points can treat the stomach, the large intestine, the small intestine. However, this is the 5 zang acupuncture approach. We mainly focus on the 5 zang. This is what's important. Okay? So, what do we see in palm diagnosis here? Bronchi and the respiratory system. So these points are also very good for respiratory diseases. Okay, so let's go for the indication first. Bronchitis, tonsillitis, heart disease, palpitation, also knee pain. They have indications for the intestines, abdominal distension. But these points are special for mainly 2 things. I will give you a case that I use it also for digestive system, because we are here today for digestive system. But they have a special effect for hernia. Okay, mainly a inguinal hernia and femoral hernia. Hernia on the upper part of the belly, on the diaphragm area. Hiatus hernia, more difficult to treat, and these points are not that good. They are better for lower part hernia. These points has indication for hernia, a special one. And for bronchitis. A patient is coming, he has a yellow sputum, he cannot cough it out. Okay? These points are really, really good for the respiratory system. One of the reasons to explain it is palm diagnosis. This is the area of the throat and the respiratory system. Okay, in terms of the imaging, it's similar to the first points that we talked. Okay, the straight microsystem, they treat the intestines. But reverse, this is the head, so this is the upper GI. Okay, so they can treat the upper GI or the middle lower GI. Okay, that's one of the explanation. But really, try to use these points when you have the two things that I mentioned. They are really good. And I'll show you today a case that I use it also. A patient is coming with a lot of stomach disorders and sinusitis and cough. So I use these points and it helped with both of the complaints. Okay, this is a protocol for cough and bronchitis. Okay, I will send you the PPTs, you'll have it. We don't have time to talk about it, unfortunately. The next points are the spleen swelling 3 points. In Chinese, it's Pi Zong. Pi is spleen, Zong is heaviness, swelling. Okay, they are located on the middle finger. Okay, let's look at the palm. The middle finger belongs to which organ? The heart. But the heart is in the middle. So there are points in the middle that treats the spleen. Okay? So spleen swelling 3 needles, it's Pi Zong E and Pi Zong R. There is another point to make it a 3-point, 3 needles, right? Spleen swelling 3 needles, named Tu Xing. Okay, 1 point, Huo Xing. So that's why it's a 3. Pi Zong E, Pi Zong R. The first swelling spleen, the second, and Huo Xing in the middle. So it's a set of 3. But you can use only 2 points as well. Pi Zong E, first Pi Zong, and Pi Zong R. Okay, so these points are on line C. It's the middle line on the middle finger. And again, it's simple. You divide the phalanx into the middle part, and then the upper and the lower are the points, right? Any questions about the location?
Just on the picture, it looks like the hand map, looks like the middle line.
Yeah?
No, not that one, the main hand one.
Yeah?
Not that one
The
either.
map of the
The map. That, it looks like the middle, where you're saying the points of the spleen.
Yeah.
It looks like it's heart, and the spleen is on the sides of the that's related.
You notice very well for the small details. You are right. I'm like you. To be honest, I'm like you. But these points, you are 100% right. But these points, where is it? Spleen swelling. Reaction area is spleen. This is what's written. And it's on the Master Dong's original book, not the apprentices. So you are right. It's here where it's heart. But this finger, remember, according to palm diagnosis, and remember, according to what I'm telling you, that it's mainly heart, but because the earth phase, it's in the middle, you find other areas in between where the earth is exist. So these points treat the spleen. Maybe you can explain it through 5 phases, and the fire phase is the engender the earth. Yeah, you can explain it like this. Okay, so these points, they are really good for abdominal bloating. Okay, all kinds of spleen disorders, or pancreatitis, or enlargement of the spleen. They treat chest pain. Okay, they are on the heart finger. And also peripheral neuropathy. I'm not exactly sure why, but from my experience with peripheral neuropathy, I see a lot of heart-kidney problems. Okay, this pivot between heart and kidney. And when I move blood, heart is the pump of the blood. Don't forget that. And heart and kidney pivot, Shaolin pivot, is about moving blood in the body. I see good results. So one of the indications, peripheral neuropathy, maybe because it influenced the heart. So enlargement of the spleen is not very common to see, but if you do see, 1106 treat the spleen, 7705 this Dharma. It's 3 points named Sanzong E. First Sanzong, the 3 weights in English. Sanzong E, Sanzong Sanzong San. The first, the second, and the third Sanzong. Their reaction area is the spleen. They treat the spleen. Unfortunately, I didn't have time to put them. Okay, 8806 we learned today. It's on the thigh. Points here, close to spleen 10, to treat the spleen. Okay? Any questions? No. Okay. So the third one, it's earth promoting 3 needles. The Chinese name is Tu Xing Er. Tu is earth, Xing is like encourage to promote movement. So the first point, Pitong were here, Tu Xing are below. Again, we see points on the, affecting the spleen. The reaction area is the spleen. Okay, but they are on the heart finger, the heart area. The same line in terms of the location. And again, we divided the section into 3. It's a 3-point Dharma because here, before we talk about Huoxing, Huoxing point is here, the upper Huoxing, the middle Huoxing is here, and the lower Huoxing is here. So the set of 3 points is Tu Xing, these 2 points, with Huoxing point. Okay? So it's a set of 3 points. Okay, so in terms of indications, again, they treat a lot of these points similar to the previous ones. They treat splenitis, spleen inflammation, acute or chronic arthritis. I don't have a lot of experience to treat, to use these points, but the reason why I chose to put them in this seminar is to highlight for you the importance that the earth in the palm area and the fingers area are in between. Okay, so although this is a heart finger, there are some indications to treat the intestines. Okay, this is an example for thrombocytopenia in pregnancy that I had good results, and these are the points that I use. Okay, 1106 and 9 are this finger. 7705 I mentioned for the spleen. 8806 we learned today. And 680607 are points here on the leg region. They treat the spleen and the liver. Okay, but they have indications for the digestive system. Okay, any questions? Okay, one area, the key points is finger earth, Zhang 2 for the digestive system. We'll see points afterwards. And fingers 3 spaces. Okay, but finger 3 spaces treat also the lung and respiratory problems. More points to consider. Kai P is over here. It's really good for low appetite. GNP in this region. Also the liver and spleen, right? This is the liver finger. These are more points. Actually, there are more, but I didn't add so much because, you know, it's the first time for you. So I don't want you to really hit me hard. Okay, jumping to 2-2 zone. 2-2 zone, we learned 3 combinations. Palm, knee, 3 needles. Okay, it's an excellent combination. Control the spine here that I mentioned before, and Lingu Dabai combination, which is the most useful combination in mastodon acupuncture. So palm, knee, 3 needles. Tu Shui. Tu is earth, Shui is water. Okay, so according to the name, these points can treat the spleen and the kidney. The reaction area is spleen and the kidney. Now, the location is lung 10, okay? And then 0.5 soon, 0.5 soon is the first point, and 0.5 soon is the third point, and in the middle, it's the second point. Okay, now traditionally, according to the 14 channels approach, lung 10 has indication for the stomach. You go and check me. They are good for vomiting, okay? And they are good for stomach and heart problems. Like in this region, the stomach and the heart are very close anatomically. Okay, in mastodon acupuncture, there are fabulous points to treat also vomiting, but acute chronic gastritis, stomach pain, epigastric pain. Okay? And obviously, because this region, right, this is the lung, right? So they have indications for the lung as well. So points, problems like dyspnea, tonsillitis, asthma. Now, I always ask myself, why these points treat the knee? And one of the explanations is the turtle image, which I find it crazy, but that's one of the explanations, because if this is the head, this is the shoulders, so this is the torso, and these are the legs. So these points has indication for sciatica and for knee pain. But you try. You don't believe me. Don't believe me. Just try. They are really good for knee pain. Will be better for medial side knee pain. If the knee pain will be left, you treat the right side. Okay? There are indications for this spot for bloodletting. If you see a visible vein in this area, you can bleed the points, not needle the points. You can bloodlet few drops from here, pop, and you squeeze few drops. Just put gloves, no problem. The indication for bloodletting is gastritis, stomach pain, cough, and asthma. These points are also good for morning sickness in pregnancy. If a female patient is coming and she's pregnant, probably there is no problem to bloodlet this area, but probably because she's pregnant, depends which trimester, obviously, but I won't bloodlet her because she's pregnant. But basically, this is not very. There is no contraindication to do it even in pregnancy. If you see a vein, there is no contraindication, but probably I won't do it. Okay. As well, it depends which trimester and if she's strong and how she feels and if she's healthy. There are many parameters, but overall, there is an indication for that. Okay? Any questions? These are excellent points. Dr. Hu from Taiwan, he has this category of 72 marvelous points. Have you heard about this? 72 most commonly used points in mastodon acupuncture. So the points that I'm telling you now, majority of them are from the 72. Okay? Very, very commonly used points.
How much sensation do you want to elicit in your patients? You need them to feel something.
Yeah, so we said there is no, we just get dirt chi, minor dirt chi, and that's it. But because we are using Daoma, so the effect is strong. Now, here you see the point, I needle with a small needle, the auricular one, 15.16. But usually I will use a 1-2 needle, 0.25 or 30. Can go all the way in. Depends on if the patient is very sensitive or not. So you can use the 15, 16 if they are more sensitive. 3 needles, no problem. To use these points? No. But I thread needle here, there are points Huai Ling. You know Huai Ling? For the neck and also for the ankle. For the ankle, Xiaojie, they know as Xiaojie points. They have other names, Huai Ling. So you thread it, it's pretty close to here, all the way to pericardium 7. Yeah, very, very good points for ankle problems. Huai Ling points. Xiaojie, also there is another name. A.05. Very, very good points for ankle sprain on the opposite side. So you thread them all the way towards pericardium 7. But for these points, no need to thread. Okay, let's go quickly. Control the spine 3 needles. 1 shun E, 1 shun R. 1 shun E and R, those points here. Just next to small intestine 3. Small intestine 3, 0.5 tsun below. It's the first 1 shun, and then 1 shun below, the second 1 shun. There are 3 needles. They called the Dharma, James Meyer called the Dharma, control the spine 3 needle. The third point, James Meyer is saying to use small intestine 3 as the third point for Dharma. But my teacher and I using small intestine 4 to affect the spine. Okay, the previous protocol that I told you about the spine, using these 3. This Dharma 2205, 22-05, it's 1 shun E, 1 shun R, and small intestine 4. Okay? But the original book of Master Dong, only these 2 points. So they affect, so this side, which channel? Kidney. So this is the liver, this is the kidney. So they treat kidney. Okay? One very interesting imaging for this point. What do you think this is? And? Come on. Be creative. Dr. Lee in Taiwan always used to say, when you do imaging, you need to be very creative. No, look at it. Nose. Nose. So what is this? Lateral side of the head. This is the head. This is the head. So Lingu Dabai, Zhonghui can treat migraine lateral side. And what does it mean? That 1 shun E, 1 shun R treat lateral side problem. They are located on the lateral side. They treat lateral side problems. It sounds funny, I know. It was my reaction, the same. I feel like you feel. I used to feel like it. But I see it in the clinic that it works so well, so I stopped laughing about it. And Dr. Lee in Taiwan, he explains all the 14 channels acupuncture points through imaging. You can start doing that. Go slowly, slowly, point by point. You can find explanation. This idea of Tai Chi in the body exists in Chinese medicine. So for one thing, it's comfortable to say, the pulse, upper jiao, middle jiao, lower jiao. Yeah, makes sense. It's 3 jiao. This is imaging, but this is imaging as well. Now, you doubt me. Don't believe me. Just try it in the clinic. Okay? So these points are very, very good for sciatica, lateral side headache, tinnitus. These points are excellent for tinnitus. Right? Now, small intestine channel goes to the ear. But we know, according to the 5-phase, who controls the ears? The kidney. Okay, these points are very good for tinnitus. Blurred vision as well. And swelling of the lower abdomen related to the digestive system. If we see a problem of the digestive system and our diagnosis, we see the pulse of the lower part of the pulse, the kidney position is weak. So we treat the root of the kidney and we treat the digestive system, the branch, the symptoms. Okay? You had a question.
Oh no, just what I wanted to ask you then, you said it, you actually answered, because I wanted to ask you what results you had with tinnitus.
Tinnitus is very difficult to treat. First of all, it's a very, tinnitus is not easy to treat, to be honest. It's not easy. But yeah, there are several of points. You can come afterwards, I'll tell you. Several of points, mainly lateral side points, because they treat lateral problems. Okay, and I had some successful, it was not resolved, but it was improved. Okay? Tinnitus is not easy to treat. So I mentioned these points, so you can see in terms of imaging. So you take this bone and you image the entire body. Okay? But as well, in palm diagnosis, when you see veins here, usually it means there is a problem in the spine. You can local bloodlet the back, the spine. Okay? So this is 3 points, needle. And we talked about this protocol, right, for the spine. So these points are very, very good for the spine.
When you bloodlet the back, do you bloodlet BAcC points then?
Yeah, the back full of points. There are many, many points.
So how do you decide where to go?
This is a big area, and you know, like always, it's divided into the 5 channels. So some lines are affecting the heart, some lines affecting the spleen, some lines affecting the lung. So if the
where it starts on the hand, then it travels down the torso.
No, because it's a different zone. So a different zone and a different distribution. It's not continuous. That's the idea. This is a very important comment. That's the idea. Each zone, it's individual zone. It's a microsystem. However, to make it very effective, we use several zones. But the most special zones is 1-1, 2-2, because they are very strong, and 8-8. The 8-8 area, we talked yesterday about if acupuncture can tonify, and if there's a patient with anemia, can acupuncture nourish the blood? And usually we think herbs can nourish the blood, diet can nourish the blood. How can acupuncture create new blood? Acupuncture can do that. And legs is the best area, the thigh area. Okay? That's a special area in Master Tung's acupuncture. Okay? Last points are Lingu Dabai. You must heard about them. Lingu Dabai. The name of the Daoma is control 3 needles. Control what? Control the qi. These are qi points. Okay, they have a special category in Master Tung's acupuncture. Every qi problems, you can treat these points. These are the most commonly used points. Okay? If there is qi stagnation, obviously you treat them. If there is qi deficiency, you can treat them, because the reaction area is the lung. Okay? Now, in traditional acupuncture, Hegu, it's the area of Dabai. Dabai is close to the bone. Hegu is here. Okay, Lingu is just in the junction. And Zhonghui, large intestine 3 is here. Zhonghui is 0.2 Tsun, next to this point. There is a name, Hukou, tiger mouth. Tiger, the animal, belongs to who? The lung. The indications of large intestine is mainly related to qi circulation. Usually we explain it, the yang ming is full of qi and blood, so it moves qi. But these points, actually also the 14 channels, they treat the lung. Lung governs qi. This is what it says, I didn't invent it. Lungs govern qi. Okay, we usually think liver qi stagnation, we want to move qi. We think about chaihu, about the herb chaihu, but in acupuncture, actually lungs govern qi. When we want to treat qi problems, qi deficiency, lung qi deficiency, weakness, or qi stagnation, the lung, with the help of the zong qi, and the heart in the chest, it moves circulation in the body. Okay, so these points are very good for qi problems. There are a lot of indications, a lot. I divided into upper, middle, and lower. Okay, a lot of indications. These are the most, I would say, the 5 most common points in Master Tung's acupuncture is Lingu Dabai. Not necessarily you have to needle all the 3 points. Lingu Dabai, I said Dauma can be 2 points, not must be 3. So 2 points is like 对药, right? 对药 in herbs. Couple of herbs. 麻黄桂枝, it's a 对药. Okay? In herbs, there is a principle of coupling of 2 herbs. So in acupuncture, there is this principle as well, the Dauma of 2 points. So usually we do Lingu Dabai. Okay? Lingu here, Dabai here. Sometimes I use also Zhonghui. If I want to affect more the upper jiao, I will use Zhonghui and Dabai. If I want to affect more the lower jiao, I will use Lingu and Dabai. Okay? In some cases, I will just needle all the 3, as you can see in this photo. So I put this photo of image because it's quite unique. Usually we don't think about it. And here, there are points that I mentioned for the spine. Spine is in the middle, right? Spine is in the middle of the body. Middle, treat the middle. Nose is also in the middle. And this image, Jiaoming, these points, 11.12. Jiaoming, there are 2 points. Jiaoming first and second, they have indication for orbital pain and nose pain and problems in this region. So these points as well here, they treat the nose because of this image. And Lingu Dabai are good for lateral side headaches, but in general for many types of headaches. Any questions? You ate me, huh? Okay, this is a very good combination for the nose. Okay, so rhinitis, sinusitis, blocked nose, common cold, sneezing, but mainly nose problems. So rhinitis, sinusitis, this combination is really good. So more points to consider, San Mao, used in the palmar area. Let's quickly go to zone 3. Any questions before I continue? Okay, so in zone 3 we have three sets to learn. This is 1 point, no set, no Dauma, no 3 points. Intestine gate, okay? Okay, intestine gate. In Chinese, Chang is intestine, Men is a gate. Okay, the number of this point is 33.10. Also in Tung's original book, it's there. And what is the reaction area? Why? Because that's the line of the kidney. Okay, so a patient is coming. First of all, the kidney in Chinese medicine controls the lower holes, right? Kidney is good for older patients' constipation, right? Kidney 6, zhao hai. But kidney controls the anus and controls the urethra and controls the uterus, right? So there is an explanation. And actually in traditional acupuncture, this is the small intestine channel, but does the small intestine channel has a lot of indication for the digestive system? Yes or no? No, right? Small intestine channel, traditionally, is good for the ears, good for the eyes, good for the shoulder, but no indication for the intestines. What the hell? This is a small intestine channel. But in Master Dong, this area is the liver and kidney, okay? And it has indication for the intestines. Thank you, Master Dong. Okay, so indications. These points are very good for colitis, enteritis, anus disease. One of the explanations why they are good for the anus, I know you like the imaging idea, you at the back. This is the head. This is the upper jiao. So this line, many points for the, if this is the head, or, no, throat. Excellent points. Which point we have there for the throat? Traditional acupuncture, lung 5 area, right? So 1 cun and a half below lung 5, there is a line of points. These points, Zhongli, Jianli, Chuli, Chuling. This combination really good for the throat. Okay, then you go down. So this area here is Changmen. This is the area of here. So they have indications for the intestines. Now this point, this photo that I put, it's the Changmen 33.10 belongs to the this Dauma, the 3 gates. Changmen, Ganmen, Shinmen, the gate of the heart, the gate of the liver, and the gate of the intestines. So usually we use it as a Dauma set. But I gave you, as an example, just 1 point, Changmen. So when you see a patient with colitis, with digestive complaints, but you take the pulse or you see other signs, she or him suffering from cold, the pulse is relatively deep and the kidney pulse is weak, and she has also low back pain and frequent urination, but she's coming from colitis, but you think, oh, the root problem might be the kidney. So this point will be the best. So you can also use it with Menjin. Menjin is 6605, the gate of the metal, okay, for diarrhea. It has a similar effect, kind of like the formula Tong Xie Yao Feng. You know the formula Tong Xie Yao Feng? It's liver and spleen problems. So don't forget, this point also not affect only the kidney, also the liver, in terms of the reaction area.
I'm just curious as to the line. Is the line is superior to the ulnar bone, or?
Very good question. You locate, thank you. You locate the point when you put the palm on the chest. When you put the palm on the chest, then you can find, you needle very close to the bone. Like this, perpendicular. So you ask the patient to put the hand on the chest, and then you find the line. Most of Master Dong's points are very close to the bones. So over there you don't do Deqi because it will be more painful for the points, but there is a strong reaction over there. So Lingu, the same, very close to the bone. Okay? There are points you mentioned before for the neck. You needle the Achilles tendon, 7701, 02, 03, fabulous points. And they are not sensitive at all. If somebody wants to give me his ankle and Achilles, I can show you that it's not painful. You can needle, and it has strong effect on the neck. And the reaction area of these points is the brain. So problems of the head and brain, 7701, 02, 03 are very, very good points. Okay, any questions about the intestine gate? Okay. The next combination is hold 3 dis. This is the English name. It's a bit weird name. Qi Jiao, Qimen, and Qi Zeng. You have all the names, Chinese, English, Hanyu Pinyin, you have everything. Okay, learn the names. But in this case, the name is, it's a bit awkward. Okay, the number is 33-10. It's also in Master Dong's original book. Okay, and these points are very, very good for the intestines, but they treat the lung and the 6th fu, right? So 6th fu, it's the large intestine, small intestine, stomach. But they also treat the lung. So they are very good points to affect as well the lung. Okay, usually when I needle them, in Taiwan, Yang Wei-jie usually explained to needle them along the large intestine channel, perpendicular. But in Taiwan, they needle it from the large intestine to the sanjiao, or the heart, in our 5-tongue system. Okay, so you take the needle, so you feel the bone, the radius, and you go superficially towards the sanjiao. Okay, this is how you needle the point. 2 cun from the wrist, 4 cun, 6 cun. And these points are very, very good for hemorrhoids. diarrhea, constipation, and anus problems. Okay, again, the image is the same. This is here. Okay, but we can try to understand it through the large intestine channel, right? The traditional large intestine channel. And you can try and see. Just try in the clinic. They are very, very good for hemorrhoids, constipation, and anus problems. So anal fissure as well. So this is a good combination for constipation. I have an example of a case I use it, and it's chronic constipation, and she came after a week of the treatment and said, every day I went to the toilet. I didn't believe. I don't believe my patients so much. So I'm like, really? And then another week, it's like, I don't know what you did, but every day I go to the toilet. And I'm like, did you change diet? Something happened? You went to vacation? You're like, what's going on? You use drugs? Like, no. I'm like, whoa. Really, it's very good for constipation. But this is a combo without the diagnosis. You need to diagnose the patient afterwards and add the root treatment. Okay? This is a combo that treats the intestines according to the indications of the points, according to image. But then you want to tailor the treatment to the patient. So this is the special part about this acupuncture. We use the palm, or you use every diagnosis method it works for you in order to understand what's the constitution of the patient, and then you add the root treatment, the points that will treat his spleen or his liver or his kidney. Okay? So this 3306 Dao Ma, it's these ones. Yao Ling. Yao Ling. Yao is back. Ling is like spirit, eternal, something like Ling Gu, the same. This Dao Ma, it's 4.5 Tsun from the wrist on the pericardium, so-called, and 0.5, 0.5. Very good for hemorrhoids and lower back pain as well. Okay, let's quickly talk about Qinling points, the next point. So it's 2 Tsun from the wrist is pericardium 6. So this point is 1.5, 2.5, 3.5 Tsun. Okay? 3 point. Shin, heart, Ling, this is the Ling, spirit. Okay? And obviously, they affect what? The heart. But as we mentioned before, sometimes patients with stomach problems, they will have heart symptoms. So these points as well have indications, epigastric pain. But most of the indications, according to Master Dong, is to treat the heart. So we treat the heart through the pericardium channel. Now, obviously, it makes sense when we think about it in 14 channels, right? This combo is really good for nausea, the first trimester. Okay? I use Xinling and 8802, just 2 points. 8802 is the points of the heart. And 2 Shui points that I mentioned before. And because it's the first trimester, you can needle Ren 12 for nausea. Okay? There is another combination from James Myers' book. Instead of using Xinling, you use pericardium 7, 5, and 4 as a Dao Ma. What's the difference, you think? Pericardium 7, 5, and 4 as compared to Xinling. Why do you think you need to use this combo?
The more holographic, middle, upper, and lower exam, something like that.
I like your thinking because you immediately think about imaging. You think, now, wow, he's going to explain this through imaging. Not everything is about imaging. But I'm very happy you answered that. The difference when I see a patient with severe, obvious heart fire, when there is fire, some kind of psychological complaints, I see like red tone, upper jiao, the upper part of the tongue is red, and red papules in the tongue, and nightmares at nighttime, maybe UTI issues. I see heat, more severe heat in the heart fire. I will use pericardium 7, 5, and 4. If not, I will use Shinling. Shinling is more commonly used. It's a very useful combination.
So this means that the distance has an effect on when you use this technique of three needles, that you were a stronger activation of Qi if there is more distance, so they will work better on heat.
In the Dauma idea? No. You can think of it that you take a larger space in the body to image larger area. This is yes. But in the Dauma principle, you activate the Qi in the same way. If it's wider or smaller, it doesn't matter. You just put 3 points. You'll see the effect will be better. You go back tomorrow. Monday you have a clinic. Don't use Neiguan. Use Shinling. 3 points and see the difference. Okay? Because we are treating zones in Master Dong's acupuncture. So the Dauma represent this idea. Now if it's longer, usually if it's longer, too long, it's not already considered to be a Dauma.
I mean, what was your rationale for using these 3 needles, pericardium 7, 5, and 4, because there is no heat?
Yeah.
Not instead the other combination when the points are closer to each other.
Because I'm still in my mind, I didn't abandon totally this idea of the 14 channels, and the drain, a hand drain, part of the drain has an effect on the blood and heat, so I would use this. But also because in James Meyer's book that I gave you as a reference, these points, their indication is more for like hysteria, patients has hysteria, and a lot of signs of excess fire in the heart. So that's why I use this, but also this rationale of the drain. Okay? So I give you these 2 explanations, or 2 Daumas to use for the chest and the heart and psychological mental complaints. Okay? Yeah.
What about adding 1105 or something like that?
Adding what?
1105.
4?
For heart.
You can. It's an option. You can. The thing is, regarding your comment, there are a lot of options in Master Dong's acupuncture. So how we choose the right one? That's a very, each clinician asks these questions because we want to tailor the best treatment for our patient. The answer is that we need to use points that we know they are more commonly used. We need to develop our own clinical experience. And sometimes as clinicians, we need to try. And therefore, it's a bit frustrating, our work, but this is the way to find the best treatment. So there is no one good treatment. In Master Dong's acupuncture, there are many options, but you need to find the best ones. And how you do it? By getting information from others, from your own experience, and from your teachers. Okay? That's the genuine answer. Okay, these are very, very important points. The upper and lower metal door. The point is 6805, not dash, 6805. It's only Menjin. So stomach 43 is here. Okay? You go all the way to the junction of the bone, it's Menjin. But in Taiwan, they have 2 points, Menjin Shang, the upper, and Menjin Xia. So it's a Dui Yao, a couple of points, like herbal medicine, Dui Yao, couple of herbs. Okay? So this is usually a couple of points, but sometimes you can combine stomach 44 from the 14 channels, and then it's a Dauma set. Okay? Stomach 44, Menjin Xia, Menjin Shang. Okay, these are very, very useful points. Top 10. Very, very useful points. And interestingly, the reaction area, Master Dong wrote duodenum and stomach. And some books, they have uterus. Okay? They affect uterus. In Master Dong's acupuncture, the stomach line, the points on the stomach line, but not the 14-channel stomach, close to the bone, have a lot of gynecological indications. Okay, so these points has gynecological effect. So as you can see here, many indications for the digestive system. There are also fabulous points for migraine, lateral and frontal headaches and migraine. Okay, very good for trigeminal neuralgia, toothache. Once I had a patient, and she came after like some tooth treatment, and she was suffering from pain. And I went to the leg, and then I saw a vein. I bloodlet, and immediately there was improvement, immediately during the treatment. So if you see a vein, you can bloodlet. So these points can be bloodlet. Only if you see a vein. If you don't see a vein, you don't bloodlet, obviously. Okay, so these points can be bloodlet for headaches, and I'll have a case as well with stomach problems that I'll show you later, and headaches that I bloodlet the treatment, and I think after the bloodletting it improved more. Okay, this point also has an effect to open the nose and the throat. We can understand that through imaging. Okay, so the ankle, this area in the ankle, there are many points to treat the head. It sounds crazy, but they are, and with good effect. Also here in the area of kidney 1, in between, there is a set of 3 points, San Shen, really good points for hypertension. Okay, usually hypertension, most of the symptoms are in the head, like dizziness, blurred vision. Okay, so the ankle treat the head, so Menjin here treat the middle, but if you flip it, it treats this region. Okay, Menjin are very important points. It's close to stomach 43, but just close to the bone. Any questions about Menjin?
On that picture there, you can see a little vein on the dorsum of the foot, but this is not the kind of vein that you would decide to bleed.
You talk to the organizers that they invite me for a bloodletting seminar. I will explain you everything about bloodletting. Bloodletting is something very safe, very easy, and simple to do, but we just need to learn how to do it. These are not considered to be. I will bloodlet smaller ones, not this size. Okay. Okay. Next, Firemaster. Firemaster is the liver 3, 0.5 Tsun to the junction of the bones. It's 6804, Huozu. So Huozu, it's fire. Treats which organ? Fire treats the heart. Okay? And below, there is Huozu, this is 6804. 6803, it's Huoying, usually like Menjin Shang, Menjin Xia, Huozu, Huoying combined together. Usually. Okay? These points are very, very commonly used. They have also indication for the liver and stomach diseases. Okay? So they are very good for postnasal drip, for plumpy chi. Okay? Traditionally, liver channel goes to the throat from the 14 channels. Okay, they are very good points for knee pain. You do it as a guiding needle on the affected side. So the knee pain is on the right, you image on the left, but then you use system number 3, the lines, distribution of lines, for the knee. It would be better if it's a medial side knee pain. In terms of combination, think about it, 4 gates. What 4 gates do? Move qi and blood, right? According to Master Dong, Lingu Dabai affect which organ? Lingu Dabai affects which organ? No, Lingu Dabai affects the lung. And 680304, heart. When we want to move qi and blood in the body, we affect the zongqi. Zongqi, increase circulation of qi and blood from the chest. Okay? For IBS, when there is a liver and spleen involvement, You can think about Menjin 6805, Huozi 6804, the 4 flowers that we're going to talk now, Xinling as well. Okay, it's a good combination for IBS. Okay, so these are a few examples of imaging. You'll have this later. More points to consider are these points. There are more points. Unfortunately, there are a lot of points that I cannot include in 3 hours talk. Any questions about FireMaster? It's part of Tung's original book, very commonly used. Okay, a lot of different indications. Also, they have indications, gynecological indications. Okay, very, very commonly used points. Okay, 77 and 88, and then we are done. Okay? I hope you still want to have dinner after this lecture. Okay, 77, very important area. 77, it's the lower leg. This is also a very important area to nourish. Okay, many points over here. They treat the kidney, they treat the stomach, and they are good for nourishment, for boosting qi. Okay, so the first combination is the 4 flowers. 4 flowers is very commonly used. So usually we take 1 finger distance and we find the stomach channel. But sometimes, you know, you have stronger or bigger patients, the muscle is bigger, right? In Master Dong's acupuncture, the stomach channel, these points are just next to the tibial bone. Okay? So the first point is the same line as stomach 36, then 4.5 Tsun is the middle point, and 5 Tsun is the lower point. These points can be bloodlet, especially this area. There is a map on the leg, and this area has a lot of indication. On the upper part is lung and heart. Okay, this mainly the upper Sihua and the middle Sihua can be bloodlet. The reaction area, 6 bowels. Also the spleen. Some apprentices, they say 4 flowers, it's the point to treat the spleen. So in Master Dong, when we want to treat the spleen, we treat the stomach points. Okay, also lung and heart. Okay, mainly the upper points. 7708, it's Si Hua Shang, the upper point. It's good for lung and heart. Okay, in terms of indications, so the one who marked in red are for the intestines. As you can see, there are many indications for the heart. We can think about it in a simple way because Master Dong's acupuncture is simplicity is one of the principles. Middle, this is middle, right? Treat the middle. Si Hua Shang, the upper one, will be the best for these indications. But usually I just use the 3, all the 3. Okay? We can think about Si Hua as well when we want to nourish blood. So stomach 36, stomach 37, stomach 39 in traditional acupuncture. Stomach 37 and 39 are Chongmai points, points of the Chongmai. They are the lower Hesi point, and these points has indication to nourish blood. These points as well we can think about when we see stomach problems, digestive problems, and we see blood deficiency, and we want to nourish blood through the digestive system. Okay, so this combination, Xinling and Si Hua and 44-02, it's a very common combination. 4402, it's a very common Dharma to treat the heart, to treat palpitation, arrhythmia, and angina pectoris. I added this point. I felt like I really have to. 2 days ago, I had a patient. She came because of urticaria. Okay? Chronic urticaria, years. She's taking antihistamines. Nothing helps her. I will tell you the results if you'll be interested afterwards. But I saw a vein here. And before, when I talked to her, everything is normal. But she's saying she has a lot of stomach problems. Okay, when I took the pulse, it was a very slippery pulse. But not a lot of signs and symptoms. And the urticaria, mainly, there are no like hives, no skin rash or something like that, but it's mainly itching. So in my diagnosis, I thought, okay, I see a lot of stomach complaints. She has acid reflux. She has problems in her stomach. And then I went to the leg, and then suddenly I saw a vein here. So I bloodlet. She came twice, and she's saying in those 2 weeks there was improvement in the skin. I don't know, but I hope I will help her. I will let you know in the future. But these indications, if you see a vein in this area, this is the area. So Sihua Zong is here, and there are more points, Sihua Li and Sihua Y. Y is outer. Sihua Y, the number is 77.14. And if you see a vein here, this is one of the most commonly used area to bloodlet in Master Dong's acupuncture. 77.14, Sihua Y area is commonly used for bloodletting. So she had a skin problem, but she showed a lot of signs of spleen and stomach. And one of the indications here as well, no, I bloodlet this point because of the stomach problems, but hopefully as well I added more points, Sima points, which are very good for the skin in order to affect her lung and spleen points, lung and spleen organs. Okay, in terms of imaging, so obviously the upper Sihua is for the head and chest. Sihua has also indication for the upper Sihua, also has indication for the eyes. Okay? So the eyes as well can be treated. Indications for the eyes, so Sihua Shang. This point, the upper Sihua, affect this region. Okay. Sihua points are very, very commonly used, but even more, it's the lower 3 emperors. Lower 3 emperors is top 5 in Master Dong's acupuncture. Many, 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 many indications, but the reaction area is the kidney, the 6 bowels. The upper area, the Tian Huang, the upper point, also can treat the heart and the lung. But this reaction area, mainly, you remember, treat the kidney. So in the legs, this line here is the kidney. The middle, Sihua, is stomach. Lateral here, Sima points, and the points we'll talk later in 2 minutes, is the Se San Li, Se Xia San Li, it's the lung. Okay, so this area, although it's on the spleen channel, it treats the kidney and the 6 bowels. So the 6 bowels, you can think about it, treat the intestines, treat the stomach. So it makes sense in the 14 channels approach because it's on the spleen channel. These points are very, very commonly used. Okay, for our topic, the upper point, Tian Huang, okay, the upper part, can affect the upper part can affect this region. So these points are good, Tian Huang point, and below there is another point, Shen Guan. Shen is kidney, Guan is gate. They have indication for hyperacidity and reflux. But these points can treat a lot of problems, as you can see from the indication, mainly problems related to the kidney, okay, but also digestive complaints. Okay? One of the explanations why these points can affect, so actually these points have 3 main areas. Digestive system, gynecological complaints, and what's the last one? And urological complaints. So you see a lot of indication of urological complaints, urinary problems, okay, and specifically for our topic, Shen Guan. This is Shen Guan. So Tian Huang is here, and then 1 cun and a half below is Shen Guan. The photo, it looks 1 cun, but usually it's 1 cun and a half. Shen Guan. These points are very good for hyperacidity.
And they just below spleen 9.
Right. So sometimes I do this combination of spleen 9, 1 cun below, Tian Huang, 1 cun and a half, Shen Guan. 3 points to treat the spleen, but kidney as well. Okay? I have a case. We reached to the case. So a patient came with constipation. Actually, she came mainly for the neck pain. She had a neck pain, and then I started to talk with her. She had like upper back neck pain on the gallbladder channel. And then when I started to talk to her, she said, I have insomnia for like about 20 years, chronic insomnia. She did everything for her insomnia. Sleeping pills. She tried many things, also natural. Nothing helps for her insomnia. And and then I'm talking to her, you know, she comes for the neck, but then she said, I have also chronic constipation. Okay, she's fatigued most of the time. Constipation usually once every 3 or 4 days, 2-3 small pieces. And on menstruation, it changed to soft stools. She takes the medication before bedtime, and it doesn't help so much. She doesn't sleep well. It takes her a lot of time to fall asleep. She had cystitis in the past, but now it's okay. And menstruation, in her background, she had polyps in the uterus and cysts in the ovary, but now she doesn't have any complaints, and her menstruation is normal. Okay, so I treated the neck, first of all. So I looked about the veins, and then I saw a vein in bladder 40. Constipation is good. Neck, bladder 40 is good for the entire spine. Okay? And I didn't mention, she also has hemorrhoid. And bladder 40 has indication also for hemorrhoid. So I bloodlet bladder 40 for the neck, because I saw the vein. I saw the vein, I bleed. Okay? And then 7705, it's this Sanzong combination. It's good for the neck. So she had the right side neck problem. I put the Sanjian points. Do you remember that weird imaging? Sanjian points here. Sanjian points, the best to needle on the same side of the problem. So it was right side. I put Sanjian. Shangshi points, they are between the small intestine and the Sanjiao. Small intestine 6 is here. 1 cun below, it's Shangshi, the upper. Then 2 cun. They have indication for the neck. Usually I like to put Sanjian and Shangshi on the same side for the neck. And I added as well Lingu Dabai. So Lingu Dabai here, Sanjian here, so 5 points here. I have a photo of this, I forgot to put. Okay? This is neck. But because she has constipation, I put 7702. Now in my diagnosis, let me see what I wrote. In my diagnosis, what was her pulse? The pulse, the kidney position was weak. It was a bit slippery and thin and a bit fast. So she has chronic insomnia, many years. Okay, I thought my diagnosis was it's a mainly kidney liver problem. Okay, so I treated the neck with 7705 that has indication for the neck, the 4 flowers for the intestines. And then because she has kidney, I used the lower 3 amperes, 7712. And 8807, it's the points that affect the liver. The upper ampere, 3 amperes, or the upper yellows. This is their name. On the other side, this is Changmen. I used Changmen and Ganmen and Shinmen. And for relaxation, I added Shinling. And I like this Dauma here. 101008 is Intang with 220 and 221 for relaxation, because she looks very nervous and she was not sleeping well. So I did this treatment for 2, 3 times, 2, 3, 4 times. Her neck was better, but not solved. She's working physically. And she started to sleep better. But then, I think at the beginning she didn't mention about the constipation, if I remember correct. And then she said, not about the constipation, about the hemorrhoids. And then she said she has hemorrhoids. And something, I don't remember exactly, but something led me to to use the lung. So I added 8803, which is Sima points, okay? And I added the Huozu points. Okay, Huozu points as well, they are very good for the scapular region. And what did I add as well? The 4406 here for the constipation. I gave you this combination for constipation and hemorrhoids. And then we did 3 treatments, and I also bloodlet ear apex. Ear apex here for the sleep. And then she came back, this is the example that I gave you. And she didn't use she stopped using the sleeping pills, and she's using it for many, many years. And every day she went to the toilet. So my insight from this case is that I thought it's mainly kidney deficiency and liver blood, because the pulse was a bit thin. But then I added the lung points to move qi, and that made a big improvement. We are running out of time. 40, but many years of insomnia, chronic insomnia, and she tried everything. Okay? Okay. We have the, besides 3 miles. 3 miles, it's Zulsan Li, right? The 3 miles points. Besides 3 miles, it's Ce San Li, Ce Xia San Li. So this is the tibial tuberosity. Stomach 36 is here. Ce San Li, Ce Xia San Li are just here. So this is stomach 36 line. Go about 1 Tsun lateral, and then 2 Tsun lateral. Distal. Okay? What is this point? Gallbladder 34. So originally in Master Dong book, you have only these points. But James Meyer added gallbladder 34. So this Dharma is gallbladder 34 plus 77, 23, 22, 23. The reaction area, very weird, teeth and lung. So if we want to differentiate the 4 flowers that we just talked and these points, you see the indications. The indications are a lot of lateral side problems. These are very good points for facial pain, migraine, trigeminal neuralgia, toothache, lateral side problems. And in terms of digestive, both of the points treat a lot of digestive problems. But the difference is that when you want to move qi more, these points affect the lung. If we think traditionally about the 14 channels, they are between the stomach and the gallbladder channel. Gallbladder, the Shaoyang, it's a pivot of qi, moves qi. Okay, but in Master Dong's acupuncture, the 5 Zhang approach, lung is governing qi, also in traditional acupuncture. So when we want to move qi, we can use these points. So if I want to differentiate, the 4 flowers will be better to affect the heart, because they are the middle. They will be better to nourish blood. But these points will be better for lateral side problems, Bell's palsy, facial tics, and intercostal neuralgia, lateral side, and a lot of stomach complaints. Okay, these are very, very commonly used points. Okay, I'll give you a case. A Taiwanese patient, she came to me, she had like chronic sinusitis, headache due to that, and then she also said she has heartburn and chronic gastritis. For years she has this gastritis. She came to me, she said the last year it became worse because of the vaccine. Then she has headaches every day, feeling like sharp pain in the eye, in the forehead, and in the temporal region. Sometimes she wants to vomit. She has a lot of tension in the upper back. But she mainly comes for the nose. And then she's saying she has as well like heartburn and hyperacidity. We worked on her diet as well. She improved her diet, but it was not resolved due to that. On the background, she's saying she's weak She's tired and she has cold. She suffered from cold. She has constipation as well. Her sleep was quite good. And interestingly, she said she has PCOS. She already have a child, but she has PCOS and her menstruation comes every 2 to 3 months. Okay, when I took the pulse, it was relatively thin. Okay, so there is a lot of excess type complaints, but the pulse was thin. So I thought it's mainly her spleen is weak, a lot of accumulation, and her lung is weak, mainly thiamine deficiency. And I took it in my mind that there is some kind of kidney deficiency. Okay, so first I did, because I thought there is some kidney involvement, so I put the lower 3 amperes, and 77.18 are very good for hyperacidity. Okay, Menjin opens the nose, and very good for headaches. And because she has a problem of the lung, and the lung treat nose problems, okay, I use Sima. Sima points are top 10 in Chinese medicine, in Master Dong's acupuncture. Sima points. We don't learn them today. And then on the other side, I don't remember exactly which side I did it. If the headache was left, so obviously I did it on the right. I put the Se San Li, Se Xia San Li, 77.14. Menjin, the points I put bilateral. Those were the key points. And Sima, I put bilateral. This is Linggu Dabai and Zhonghui. And here I put Mu points. Mu points are on the large intestine, this finger. So today you learn Da Jian, Xiao Jian, Ce Jian, 1, 1, 0, 1, 0, 2, 0, 3. On the other side, you have Mu points. Mu points are indicated for the nose and the eyes. Very good points to open the nose and the eyes. Okay, so she came to me 3 times, once a week, and then she said that her headache decreased about 50%, and then for 2 months she disappeared. I don't know why. Okay, probably I didn't help her. Although she said her headache was better. And then she's coming back after 2 months, and then she's saying, listen, my head is pretty much 50% improved. It's better, treat my stomach. So then I went to her leg, and suddenly I see a vein. I don't know why. Maybe previously I was too busy in the clinic, I didn't notice the vein. So I saw the vein in 6805. So I bloodlet. Okay? And what I also bloodlet is Wei Mao Qi points. Wei Mao Qi points are points here. Why I bloodlet them? Because she said, focus on the stomach. I'm suffering from the stomach. She had a lot of acid reflux and gastritis, basically abdominal distension and pain, and she said it on the first time as well, but then she came for the nose. Okay, and I tried to needle everything. I tried to do everything, but sometimes it's not enough once a week. She used to come from far away, not from Amsterdam. She used to drive 1 hour. Okay, so after I bloodlet these 2 points, also I added Tu Shui, right? Tu Shui can treat the lung. She had nose problem, sinusitis, chronic sinusitis, but Tu Shui has indication for the digestive system. We talk about it, acute chronic gastritis. Okay, so the aim of the treatment was this time to treat more the chest. The first treatment was more the head. And what I did, I changed. I didn't use the lower 3 amperes. I used spleen 9 with 77, 19, and 18. This combo, it's a very good combo to treat the digestive system, but I don't remember now why, but I suspected there is some kidney involvement. So Shen Guan treats the kidney. And then she came for 5, 6 times, and her stomach improved. After I bloodlet, it improved significantly. Seriously, you can talk to her if you don't believe me. And what was interesting about this case that the headaches will disappear, really improved significantly. She said like the level was 3 from 9. And when she came, she said, every day I have headaches. Ibuprofen is not helping me. Nothing helping me. And then I'm asking her, how is your menstruation? And then said, you know, I don't know what happened. It comes every month. And we did about like 3 treatments, and then there was a break of 2 months and another 5 or 6 treatments, and her menstruation became regular. Okay, so this was the set. And I forgot to mention, this is 小件, 次件, 大件, the points here, right? 11, 11, 01, 02, 03. They have indications for the digestive system, and also they have indication for the nose, for the lung. So I added these points. I took off mu. Mu is this side. I took off mu and I put these points. Okay, so these points treat both the lung, because she had chronic sinusitis, but also the swellingness. And basically the headaches, the heartburn, the hyperacidity, and her menstruation became almost normal, I think. Okay, I think we need to finish, unfortunately. And there are more points on the 7-7 area to consider. And basically there are 2 combinations on the thigh, 8-8 area, that I'll send you the PPTs and you can learn them by themselves, by yourself. And any questions? Tons of questions.
I mean, what it looks like is that you do a little combination, that you do the protocols that you done lots of times, but then I see a few kind of points from the regular
14 channels.
How often do you kind of combine those? Are you quite purist about it, or you don't mind?
Not a lot, not a lot. Dr. Lee in Taiwan used to say always, when you learn Master Dong, you need to throw away everything else. I disagree. I think it gives you different dimensions when you have the 14 channels and Master Dong, but usually most of my treatments are pure Master Dong points. But sometimes I don't bloodlet the ventral trunk. Sometimes I needle it. So CV12, stomach 41, it's a very good combo. CV12, stomach 21, 1 Dauma to treat digestive complaints. So I don't
use the principle of kind of the 3.
Yeah, but I needle. And seldomly I'm used regular. Like you see here, there are many points. But by the way, this protocol has many points. 3, 3, 3, 3. In one limb, no problem. And I don't know to compare myself to others or to compare myself if I use regular TCM approach, what was the result. But sometimes, you know, she came with the bloodletting part, and immediately there was effect. The nose was open and she had headache, and the idea was that she complained about the stomach as well, and then the stomach improved, and this point has indication for all. So I treated several complaints and the menstruation got better, so I think it's a good result overall. And not a lot of treatments and no herbs. Thank you so much for your listening, and yeah. You can take a photo of my email, and if the organizers won't send you my slides, I will. So just contact me and you get all the information. And if you have any questions about Dong Si Jian Jiu, Master Dong's Acupuncture, please contact me. And it's just the beginning of the journey to learn more, okay? It's a short seminar. My apologies for the rushing.